that doesn't keep going, and they get sick.
Yeah. You're on vacation.
Okay, so we want to start all over again. Also, not everybody was here, so we can go a little bit backward and talk about, and in the end, if we have some time, maybe we'll talk also about maintenance if possible.
Yeah, the machine's very easy. I actually hire someone. You can usually do that through, if you have a secondary laser company that comes in and you bought the laser from them, they could probably send someone in every 6 months to do their maintenance. Off the record, it's not expensive. As Cynosure is a whole, they cover everything. But with this, I mean, I think it's, I forgot, maybe it's $500 every 6 to 8 months. And they clean out the system, they just check everything and make sure everything works well.
We have somebody like that.
Yeah, so I mean, I can tell you about how to change the filters, how to, keep the fluid going, things like that. But really, this laser is meant to be a workhorse machine, so you can use it all day, and you should be fine with it. I mean, one of my offices has this. We have it for like 6 years, and since the Icon first came out, and there's, thank God, no issues with it. So. It's a pretty good laser. Okay. So about the SkinTel. The SkinTel, like I said, is newer to the Icon. We didn't always have a SkinTel on the Icon. The good thing about the SkinTel is that when we skin type patients, we tend to err on the side of caution, right? We always do this because we don't want to burn anyone. Excuse me. But the way the SkinTel is helpful is that it actually gives you a very accurate reading of the amount of melanocytes that are present in the skin, so that you can be a little bit more aggressive than you might have not been. Had you just said, okay, this person looks like a skin type 3, their ethnicity is Middle Eastern or Mediterranean, they can tan, let's scale back. Had you used the SkinTel, you could probably get higher settings where you can give them a more accurate, more efficient treatment. So that's why we like to teach the SkinTel, and that's why we like to have you guys use the SkinTel, but you don't have to. I don't have a SkinTel in my office. I use my judgment. So that's why I do like the SkinTel. So, but you don't need to use it. Just know that with anything, of course, you guys have been using lasers, and you know that sometimes the settings in the book can be lighter, and sometimes we have to push the limits to get patients' results. But we always want to be safe. So that's why I really, and I can show you guys how to use the SkinTel very accurately, and how to pay attention to the consistency, because you might do 3 readings and see 3 completely different numbers. You have to make sure you're on the area that you're treating. You have to make sure you're not over a pigmented lesion, things like that, where you can be very consistent in your reading and then figure out your settings from there. So in general, you guys have the Icon. The Icon comes with a Max G. Do you guys have the yellow handpiece as well? Mm-hmm. The Y. Mm-hmm. Do you guys have the red?
I think so.
Yes.
Is that the hair removal one?
The hair, but you guys have laser hair removal here? So forget about your red.
I do want to learn about it too.
Okay. So I'll just go through each handpiece and why we use different handpieces. Let's talk about the IPL part of it. So your color-coded handpieces is an IPL system. Your numbered 1540, 29, what is it, 20, what do you guys have, 2940? 2940. These are your laser handpieces because it symbolizes the wavelength that we're using.
Right.
So your Max G, your Y, and your R are IPL handpieces. So what do we use IPL for? We can use it for so many different things. IPL can be great, but for hair, it's not selective. It works. I've done my whole body with an IPL handpiece. It's great. You probably need a few more treatments than you'd see with an Alex or maybe a diode. So you might do 8 to 10 treatments on someone. But it works. So you can still use it, especially what's nice about this handpiece for the hair removal is that it's a very large spot size, and the cooling is a contact cooling, and it works very well. So if you have a lot of different lasers and someone's busy with one laser, what I would suggest is maybe use the red for maybe your first few treatments. It's going to be much more comfortable than some of the other lasers that are out there, because that cooling tip, it's a large spot size. It's, if you press down, it really cools off the skin, and it can make the very sensitive areas like bikini, underarms, a lot more tolerable. And then you can kind of switch them over, because you know IPL is just not focused enough. It's a broad band, it's a spectrum. So when we're treating hair, it's looking for the pigment, but it's kind of picking up everything in the way, you know? So that's why I would say you can start off with your red and then transfer them over to your lasers if you want to have more use out of it. So I would do that. So red is only for hair, that's it. So that's what you use red for. Your green, very powerful IPL handpiece, very good for pigmented lesions and vascular lesions. It's one of the best in the market. I've used many lasers over the years. Very powerful, works very well. So what are we treating with our green handpiece? We're treating only skin types 1, 2, and 3, and very light 4s. So, because it's very powerful, so you don't want to use it on your patients that are kind of in between. So, skin types 1, 2, and 3 for pigmented lesions, vascular lesions, flushing rosacea, anything red or brown, and or a combination of the two. Of course, a lot of our patients have a combination. What I like to do is, because you guys have the yellow, I usually start off the green handpiece and designate that for the face alone. And I use my yellow, because it's a larger spot size, for clearing up pigment in the body, just because you're going to cover a larger surface area at one time. So it'll just make for a quicker treatment. So let me just fast forward for a moment to yellow. Yellow is for pigmented lesions on a little bit of a darker skin tone. So what does that mean? It doesn't mean you're going to treat a skin type 5 with your yellow. Absolutely not. Your yellow is still covering your 1s, 2s, 3s, light 4s. But we all have those patients that come in that are naturally maybe a skin type 2, but have so much sun damage that the area of maybe their chest or their legs or their arms would actually type another shade higher. So you want to be careful with them, because if you use that MAC sheet, they are going to feel the heat. It's going to burn, they might blister. This is a powerful handpiece. So I would start them off with a Y. You have a larger spot size, you can clear and go over everything faster. Maybe do the first treatment with the Y, maybe do 1 or 2, and then when you get really nice, you know, when you can see, okay, we've cleared a lot of the darker pigment, you can change over to your green. So that's how you could really utilize the yellow handpiece a little bit. I would say the yellow is the least, the handpiece we use the least, just because it's kind of that in between. So yellow also treats finer, lighter hair, even though of course we know that finer, lighter hair is not a good candidate for hair removal, but we use this handpiece for people when they come in on their 6th and 7th treatment from laser hair removal, and we've changed the texture of their skin, of their hair. So now they're coming in, they're saying, you know, I'm getting these, like, just these few little wisps. Can we try and get those? So I would use the yellow instead. Okay.
The same settings that you would for an IPL though, or is it changing the settings?
Do you guys have your? I'm a chart
Yeah.
person. Like, I'm very big. I mean,
have the chart, I guess.
I'm sorry.
Oh, and Claire also sent us the book on this stuff.
Yeah, I happen to be a chart person, so I follow the charts, and of course, I don't stay within the limits. Like when I train for Cynosure on the record, I am training only on settings because we can get in trouble if something happens. But you know, I do sometimes trick the settings. You know, you'll get used to the settings. Of course, it's a powerful hand. They're all powerful hand pieces, and they all work very well. So you know, I would always start on the lower side, and then as they come in, you can kind of increase. So that's really the different IPL hand pieces. Any questions so far about that?
There was a comment that you don't use the green on the neck or other parts of the body, but only on the face.
You can, for sure. I always use my green hand pieces on other parts of the body, but you just have to make sure your pulse width is accommodating for that. So typically, if we're working on the face, on most people, if they're skin type 1, 2, or light 3, you would start with like a 20 millisecond pulse width. But when you're going to the body, you definitely want to bring it to a 30. So you can do G with the hands. You know, anything off the face, start with 30. You might clear their pigment so well that they can even tolerate a 20 millisecond pulse width eventually, but you don't want to do that right out of the gate. You're going to leave that for your like very stubborn pigment. And do you guys have those little masks? Did they give them to you?
Mm-mm.
So you can make one with an index card. Hi, how are you? Cynosure has it's like a piece of plastic, and in the plastic it looks like 3 different size punched holes, and we call them masks. And what they do is you can hold it over a pigmented lesion to isolate that lesion.
Yeah.
You don't have that?
No,
Yeah.
Maybe so we can get it.
Yeah, you said that already, so.
They're real small.
Who said you can get it?
You did, the last time.
Is that the
We
real
have it on
small?
tape.
Yeah, it's
You
recorded.
can do that with blood vessels too.
Right,
Right.
right. You could do blood vessels. You could do anything that you want to isolate that
It's
maybe.
like a PDO, but instead
Yeah,
of
if you're not doing like a global treatment.
It's not like a thing that you would put on the tip.
There is an applicator that Cynosure does make that goes on separate, but the problem with that is that it's a plastic tip, and you have to increase your power by like 2/3 in order to be equivalent, like you would had you not had that applicator on. So I find that when I teach people get so confused, so many burns happen from it, and I'm like, just don't. It's a disposable, so I'm like, as a business owner, you don't want to increase disposables, so I'm like, forget that thing. Use the mask where you can personally isolate. So, you can get creative with that. I've done in my office, if I couldn't find my mask, I take an index card and I punch my own little holes, or if someone has.
Oh, there you go, Lily.
Yeah.
Get the mask.
The masks are great because they're great for the hands areas, but you can,
Yeah.
you can get creative because sometimes people come in and it's not this perfectly symmetric sunspot,
Yeah.
and you have someone that has a spot that's, so I kind of cut it out and then,
Take some good notes. Okay.
so that's a way to
So when
really.
you do that, you don't have to necessarily change the settings. You're just being a little bit more specific about
Exactly.
what you're doing. All right.
Because you are isolating and you're protecting. Essentially, what you're doing is you're protecting the rest of the skin. So if you're protecting the rest of the skin, let's say you're on the face or on the body, you're only isolating that one lesion. Your settings are fine. It's when you're off the face that you really want to deliver that energy over a little bit longer period of time, just because the density of the skin is different and it's going to reflect differently. So people will get more burns if you don't lengthen the pulse width a little bit.
Gotcha.
But that's why I always tell people, if you start with your Y on the body, you will be less likely to have burns because you have it's less of a power. It's not as direct of a the wavelength for the G handpiece. It's like 500 to like 580, and then they have a shut off, and from 600 to like, I forgot what the other, maybe to like 650, it doesn't waste its energy there. So it's very specific whether you're dealing with pigment or vascular lesions. So that's why it can be very powerful. The yellow is not as powerful, so if you start with that, you just look on your chart. If I'm treating the chest, I'm going to start with this, and then then you can graduate to your G. You'll be much safer. Your patients will be happier because they're not going to feel that like intense burning.
So this might be kind of a dumb question, but say that could you treat with the Y and G, like after a few treatments the same day? So you could do the Y like total thing and then do a little bit more power with the G for a specific lesion?
You could, just be careful because now you're almost like stacking pulses, right? So, you could. I would probably, just because, I would probably say do 2 treatments with the Y and then do your next treatment with the G and then see what happens. Obviously your endpoints. you want to see a slight erythema or change 1 to 2 shades in the pigmented lesion that you're looking for.
Mm-hmm.
You know, you're allowed to repulse on that lesion if you see no physical change.
So you're saying only about 1 pass for all these, or?
Yeah, with a 10% overlap, if it depends, you know, it depends what you're seeing.
Mm-hmm.
If you're at the right settings, you know, what I usually do is I tell people, make a little line, like almost like you're mowing the lawn. So I say, you know, make 1 line down, whatever you're treating, let's say it's a chest. You go down with one setting, down with 1 line, and then take a step back, wait for a second, because everyone shows a response at different timing. Darker skin tones have a delayed response. Lighter skin tones, you'll see it right away. I take a step back, I take off my glasses, I just look for a second, observe, and if I'm seeing a response and something's happening, I'm good. I know I can continue on. If I don't see much, what I'll do is I might go up to, 2 joules. And then I'll go over. God bless you. And my overlap, I overlap extremely tight, so you don't see any. So like a 10% overlap, row to row, row to row, line to line. So I don't like to go over things twice because, again, if I'm treated with an IPL machine, you won't see much change until I'm already home. And by that time, if you double pulse that person, they're already burned. So I don't love to double pulse. I pretty much don't double pulse anyone. I just make sure that my treatment is efficient by just observing the skin. And sometimes I leave the room and come back. So I think that's a better way, a better practice to do, So that's overall. We'll talk about settings when we're on the machine, hands-on, we're treating people. What else? 1540, so we're just moving on to the laser. Any other questions about the 3 IPL hand pieces? Anything specific that you guys are experiencing that you want to talk about?
No, I think once we get to this second.
Yeah.
For instance, when she was here for our last training, and we were like, you should have seen how much brown was on her face. We were like, awesome, she's gonna get this awesome response, blah, blah, blah. And then we did it to the point where even the trainer was like, I don't know if this machine's working because her brown spots did not turn darker.
Do you know what her settings were? Offhand?
I have it written down.
Yeah.
I put it in her
I'm
chart.
just curious.
I want to say we started, I think we did 2 passes. The first one at a
20
15
mil.
MS.
115,
Yeah,
120.
and we just did whatever the skin tell told us. But and then the
I think it
second
was
pass we did at
36,
20.
maybe?
Yeah.
6 joules.
And it was but she got an awesome response. We thought she was going to get 0 response because we didn't see it.
You didn't
and
see
she's
anything.
the typical person you would see those brown spots pop right up. You know what I mean?
So every now
So
and again,
strange.
someone's skin shocks you a little bit.
Right.
Of course, we know that darker skin will respond later, but sometimes these patients do the same.
Right.
The skin type 2, that you would type them as a 2 and you'd be like, oh yeah, I'm going to see erythema immediately. It depends on someone's sun damage. Some people have a lot of sun damage, so their skin is used to being damaged. You don't really see a response, right away. So,
Yeah, so the trainer before was telling us, and again, we're going to get into settings later, sorry. If you're looking for red, do a 15 MS, and then if you also want to hit the brown, then do a second pass at 20 MS. Is that something?
so red and brown are 2 different things, 2 different targets, right? We have brown. Brown has more pigment than a red target. Red targets, you're always going to look to deliver the energy in a quicker fashion, more like a hit, because it responds better. So the difference between the 2 is you're taking, and I don't know if you guys, if you know this, and I'm repeating myself, and you guys I know what you're talking about, then stop me. But the difference between why deliver your energy over a slower period of time, so 20 milliseconds, 25 milliseconds, 30 milliseconds.
More time to cook it and heat.
Right, so it's more time to deliver that energy. The times we want to use that is when when there's not much. We know where our target is. We're going to tell the laser, this is brown. You're seeing brown. There's no question. It's just woman has brown all over her face. The laser is going to know what it's doing. You don't have to tell it. You don't have to trick it. It knows it's there. So darker pigment you're not going to need to use those small, shorter milliseconds because it's apparent.
Mm.
You're going to use your 20, 25 even sometimes even 30. I've had patients years ago I had a girl, I'll never forget this, with green eyes, light skin. She was half Irish, half Italian, and I treated her at a 25 milliseconds with maybe like 36 joules. She was burning. I never expected her to respond like that. So you have to be careful. You have to be careful. If someone has a lot of pigment, you're gonna really take that milliseconds and leave it longer. I would never really do a pass of 15 and then a pass of 20. What I usually do is the opposite. You want to do the safer pass first, and then go over with the shorter pulse width, because you don't want to do a short pulse width. Now you have all this erythema, you have all this edema, because that's what it does. If you got hit faster rather than getting hit at a slower rate, you're not going to see as much edema. So I would definitely do it the opposite way, if even do that. If I'm doing a global treatment, the first treatment, I usually stick with one setting, and I'm like, this is like peeling corn. We're trying to get past the green and go to your beautiful skin that's underneath. And it's going to take a few sessions, and nothing's going to happen in one try. So when someone comes in with a lot of damage, I'm like, right now, I'm touching the surface. I want to sprinkle and get rid of all the stuff that's on the surface, and then when you come back, I can tailor it. And by 3 treatments, people are done. But you have to start somewhere. You know what I mean? So I would more or less do something like that. And then, if someone doesn't have any brown but is very red, then you're going to use your short milliseconds. So vessels, flushing rosacea.
So you're
things like
saying
that.
start more at a 20 and then a 15 instead
If
of
you
the
were to
15.
use 2 different settings in one treatment. but
Right.
you said
Otherwise,
don't even
otherwise start
Otherwise,
at
I've closed vessels with a 20 millisecond pulse width. It's all about your pressure. It's all about your technique.
And so don't really do the second pass?
I don't do
Okay,
second
all
passes.
right. So I think that sounds safe, but
Yeah, unless I do a full global treatment and and I look around the person's nose and I'm like,
a couple.
those really didn't do anything. So then I go back and I might go over
Spot
that. Right. Or if someone says, oh, this spot, let's say they have a lot of sunspots on their face, but there's one spot in particular that they absolutely hate.
Right.
So I might go over that one spot again.
Yeah, with the same.
Either the same, or depending upon what I'm seeing, if my settings were good enough, I should be able to use the same. If my
Okay.
settings are kind of weak and I know that I don't really see a lot of stuff happening, then I can increase it.
For those of us who are out of less experience, would
Yeah.
you say to be safe, do the way you're saying?
Listen, always be safe, because with IPL, especially this one, you can depigment the skin, you can take people's pigment out of their skin, they will have white spots, you can leave them with squares all over their face that will last for months. I've seen it from the most experienced.
Really?
Yeah.
Why are they called those for? Is it just because
It's your technique with the handpiece. It's typically when you deliver your energy, when you arc. So the energy has to go in evenly throughout the tissue, and if you're not if you're overlapping and you're not creating any spaces, you're not going to see the squares. If someone has a lot of sun damage and you're kind of like haphazardly zapping, you're going to see all the squares, because the squares is where all the pigment's kind of lifting. So you just have to make sure you overlap. So that's why I always start with a global treatment on almost everyone. Even if someone has just a few spots here, I just do their entire face so they get a really nice, even treatment. And I'm not worried that one spot's going to look different,
And how soon are you bringing them back in for a second treatment?
3 to 4 weeks.
And how much do you charge for a treatment?
In my demographic, I don't know what your clientele is here. I charge $300 a treatment, but if they do 3, I 10% discount the
Where are you at?
I'm in New York, but in Queens, so I'm not in Manhattan. I'm a little outside of
Okay.
Manhattan.
Yeah. You used to charge 200, I'm telling people 250, but I think we could.
Fair.
Yeah. I mean, some people around here charge like $700 for a
For one treatment?
For one treatment?
It's ridiculous.
It's ridiculous. I'm like, you can get like.
Yeah, I
And
mean,
like, that's a
it depends on your market. I mean, we
Right.
have, of course, in Manhattan, you have doctors that are charging that, and then you have Groupon on the next corner that's charging like $50.
Right.
So it's like, you know, I always tell people, look, I'm not going to be the
I think
cheapest,
that's
but
like
I'm
a
not the
fair
most
price,
expensive,
yeah.
but you pay for what you get.
Mhm.
And with me, you're going to get results. I'm doing this for years. I'm a nurse practitioner. Like, I don't know what to tell you. You know,
Yeah.
if they don't want to spend the money, I'm like, you know, I'm good.
Yeah, no
Go somewhere else.
Come
I don't-
back here and have those squares on your
Yeah.
yeah.
I'll fix your mess ups, and it happens all the time. They leave me, they come back for everything, whether it's injections. I'm like, you came back. Why? Would you go to someone else?
Right.
When you get squares looking like squares, it's because of not overlapping?
Yeah, it's because you know, if someone, especially on your like skin, you might not see that because you don't have a lot of pigment. So if you did one little zap on your nose, let's say you had a vessel, you're not going to see it.
Right.
But if you have someone that has a lot of damage and you just decide to make one zap, you're going to see that little square. Yeah. The other thing I was saying about vessels and treating them accurately and treating them with the right pressure is that vessels you can compress. So even if you use a 5 millisecond pulse width and you're putting a lot of pressure down that vessel, you're closing the vessel, you're not going to touch it. So the key with vessels, you can get beautiful results from a 20 millisecond pulse width on a gorgeous vessel. You'll get, you know, you can use a 20-38 and you can close that vessel right up if your pressure is nice and light. And you don't keep it there for a minute, and then, because again, you're cooling the vessel's going to close. So your pressure has to be right according to what you're treating. So we'll do that when
Okay.
you guys are kind of practicing. So 1540. 1540 is laser resurfacing, skin resurfacing, for reduction in fine lines and wrinkles, for acne scars. We have an indication for stretch marks. What else? For enlarged pores. We call it just general facial rejuvenation. Do you guys have any other facial rejuvenation devices? Which ones? Clear and
Pico,
Brilliant,
right?
Fraxel. Oh, Pico.
People,
We have an Infinity, we have a PicoSure, we have a CO2, we do have a Pixel
Yeah.
2940, but nothing like this.
Nothing like this. So what's great about this and how, that's why I'm just trying to figure out what else you have so you can figure out where this fits.
Mhm.
Why people love 1540 are your patients that do not want quote unquote downtime. This is not a real downtime procedure. For your high, you know, your patients that are very, you know, antsy and they're very, you know, type A and they get nervous about everything, you're not going to tell them this is no downtime because it certainly is some redness and swelling. But for your patients that have had cosmetic procedures, this is nothing. They
What
wake up the next day and they're fine.
Sorry.
Go ahead.
What is the actual? Is it just redness, swelling?
Yeah.
Like
So-
3 days.
Yeah, about, it could be 3 to 7 days, and you always have to tell them that because of course everyone's skin is different.
One day.
Okay.
One day.
Yeah,
One day.
so, and this is exactly what everyone says. I always tell, I'm always the type of practitioner that I'm always like, 3 to 4 days of redness and swelling, your face is gonna look blotchy, you're not gonna love your skin for a week. And then they come in and they're like, what were you talking about? It was the best treatment, it was only a day of downtime, the next day I was fine. So like, but this is 90% of your patients are gonna say that this was nothing. Having said that, we all know that you can't create miracles in one no downtime treatment, so you have to manage their expectation. So I always tell them, this is meant for the working person, the mom, the person that's in the spotlight. We have a lot of models that come in, girls that really can't do downtime. You need more treatments. So if you want to see the same results that you would see with the CO2 laser, this is not something you're going to do once or twice and be done. This is something that's a maintenance. It's going to be probably, in my office we do about 4 treatments monthly.
Monthly.
Yep. And then we go from there. The way 1540 works is the target is water, so it's colorblind. It is not looking for pigment at all. It's just going to the dermal layer, displacing water from the cell, causing an inflammatory response, and your body is doing what it's supposed to do by creating more collagen, more elastin. The best side effect of 1540, even though we call it a texture improvement, is that a lot of your clients that are starting to age or are aged will see some tightening, and that's really nice for that. The skin does tighten up a little bit. So it is a beautiful treatment for what it is. And you can price it accordingly, you know. It takes you 10 minutes to do. And it's...
So, again, sorry to be personal,
No,
but
it's
how
okay.
much do you charge for this?
we charge $450 a treatment on a standalone, and if they package it in a series, like I do a series of 4 for $1,600 and a series of 6 for $2,000.
Would you ever combine the 15?
Yes, I was gonna tell you that.
Oh, the
What's-
1540 with.
Max G.
Well, yeah, that one, but also could you alternate it with, would it be beneficial to do even the Pico? You know, like to just get that texture with the elastin, but like surface and then do this for underneath? Would
Yeah,
that be a
so you
benefit?
guys can be very creative because you have other technology,
Yeah.
especially in enticing your patients to do, you know, your technology is here, you're paying for it. It's not costing you any more for it to sit here. So what I like to tell people is do a package. Say, you know, buy a package of 3 resurfacing, get 2 Pico free. You give them exposure to both treatments, they talk about it, they do it.
Shoot, not the only one to turn it
Oh,
off.
oh, really?
That's not.
Oh, that's not yours.
So yeah, you can definitely do that.
Right, I just didn't know if there was like a.
I don't know that I would do it in one day.
No,
This
no,
is-
no,
yeah,
no, I think like just to alternate.
Yeah,
just
absolutely.
different. Okay.
absolutely. Yeah, you can like alternate them. You can do a 1540 and then
How deep
2
is
weeks
this
later.
going?
Dermal
Yeah, the
injury.
yeah.
Because aside from using it along with something else, there's really no benefit in a single treatment of the 1540.
If you have young clients that come in, yeah,
Okay.
like 20s, early 30s, they want to do it as prevention. They want one treatment.
What
And
about
how-
someone just for like, oh, I'm sorry, Dana, like right before an event or something like? Would it be
Nah, I mean,
beneficial for that?
not
Or
like your
not
peak.
even?
I would use your Pico for that.
For
I think you get more of that instant glow with that. I would say the younger crowd, they will notice a change in just one treatment, but the more advanced you get age-wise, and if someone does have some significant damage in their skin, they're not going to see that much from one
Okay.
treatment of the 1540.
And how soon are you seeing a difference, would you say?
I usually tell people after 3.
Similar
Um,
to like the Pico almost.
yeah.
I feel like it's.
Yeah.
You know, after 2, some people will say, it depends how aggressive you are with them too, you know? Your settings are important, your overlap is important, how many passes you do, you know, so this will all kind of dictate what kind of result you're gonna give them. If they only want a 1 night of downtime, you're gonna do it at maybe 30 millisecond and, 30 joules and do 1 pass. So,
What's the most of the passes you can do on the 1540?
I think on the XD, the D is a maximum of, I think it even says up to 5. I have to look in the book. And the
3 to 5, I think it is.
yeah, I think it's 3 to 5, so 5 max.
Oh, wow.
And the XF is 2 passes.
Right.
Have any of you ever had the treatment?
Me.
Yeah, it's hot.
It's
It's hot.
It's the
So bad.
And it's
then
a-
so
it's a-
bad afterwards.
Yeah, it's a hot. I call it a
know
hot
goes
needle.
away right away. Yeah.
Yeah.
This one like it lingers
Mhm.
for a while.
Yeah, it's and it's
Still
very.
recovering
We
from
were
it.
like dying. We were like, I can't believe
What's
we
that?
did this to people.
I don't think
It was
she
awful.
had that though.
No,
She had
because
the
she was
numbing
numb.
on.
We numbed
She
her.
had
Thank
the-
God.
We did it without.
No,
they
I did it
did it with
Yeah,
air.
I've done
And I
it.
was like, you're fine. You're fine.
She's like, no, keep going. I was like, oh my, I was like,
It hurts.
I thought we were losing you.
Yeah, it's not a comfortable treatment. So, you know, that's why I'm like, you know, how many, I laugh at the manual and they're like, oh, do 5 passes. I'm like,
Oh my god.
who's going to sit through 5 passes?
way.
And I feel like the days would be like.
Yeah.
I only
yeah,
think we
yeah.
did 1 barely.
Yeah.
Yeah, I do it. I usually do everyone on a 50-50 overlap.
Yeah,
so
yeah,
I,
yeah.
so
That's what I
I'm
did.
really
I did that
covering a
twice.
lot.
Yeah.
But I
more.
did 2 pass. Can you do the 50-50 overlap but do 2 passes?
You
and
can.
then-
They're gonna
okay,
be.
I did-
They will have more sound.
She had done.
downtime.
She was gonna, and I did the Max G first, and then I
Yes.
did 2. Oh my gosh.
Yeah.
But the,
And
But yeah.
so again, the settings he told us last time was it's always 1540.
Always 15 milliseconds. Not necessarily 40. It depends on your patient. So we all know that we can get post-inflammatory hyperpigmentation, and with this machine you'll see it. You will, especially in someone that's darker. So do you guys put them on anything that suppresses melanocytic activity after?
We will sometimes do a pre-treat as well.
I always pre-treat everyone. I don't do anything without pre-treating, but not every office does that. That's great. But do you use anything? What do you give them for after?
We haven't really done anything.
Yeah,
We
I
haven't
mean,
really
as far as
used
this
it.
is concerned. we
Yeah.
haven't
So
done
I
this
would
yet.
just anyone that's like a 3+, I would just give them something that's going to just suppress that. I don't know what company you use, what kind of skincare you use. I wouldn't say a hydroquinone. You don't have to go that far unless you're treating someone that has a history.
Could you just
of-
simply do Retin-A? Would that help?
You
at all?
can,
Or-
but you know, so they might still get a little post-inflammatory
Probably like
hyperpigmentation. It's just gonna.
Yeah, I wonder if we could do that. I
Definitely
always
one.
forget we had that.
I had that when I had it done. It got off darker for about a day or two.
Yeah, that's a bronzing. You'll get that because that's just debris that lifts up to
We have
the
that
surface.
Koji
Oh,
cream.
okay.
Koji with
That's
RBGs,
normal.
right?
Yeah.
But some
We have
people get,
two.
you're
Oh, we
lighter
have one
skin, so
that's
you
like
might not
similar to
make
the Koji
pigment like
powder.
that.
So
But
we
like
should
I
do that.
would,
Yeah,
I get
that
like
one
a darker,
is
like
How
a
much is
4%
that?
pixelated look that
Huh?
remains for a few
Oh,
minutes.
yeah.
Yeah.
I'm gonna totally add that in
What's
there.
the-
I'm just gonna charge it
Emollient
and
ones that
then
we have
just
now?
give it, you know what I mean?
Which one?
The emollient one, so there's one that's hydroquinone and then the other one is emollient. It has like the Kojic, the whole thing.
Yeah, so those are great things
Yeah.
to add on.
Yeah.
Yeah, anything with
Koji.
like, not necessarily hydroquinone, but like a
I
kojic
don't know, we'll see.
Like-
lactic
Yeah,
combination
yeah.
or, you know, any alpha or
Yeah, that
beta.
one's good. 'cause
How
it's
soon
only
after
4
treatments do you recommend using that? Starting to use it?
I would say like what, like 48 hours?
Yeah,
Yeah, I
a
would
day
say
or
like-
two,
I would
yeah.
say
Okay.
even
This is non
24.
ablative, so
Yeah,
you're
you're
really
right.
not.
So just do whatever, right?
Yeah.
Yeah,
Um,
so,
And so,
You're talking about this comes in our,
The red,
after this,
the new ones that we have.
it comes in our books.
We just got
we
it.
get it so cheap.
People are like loving it and I'm like trying to sell some.
Yeah.
I haven't even, I totally forgot to even
I
have
just
that.
know,
Yeah.
yeah, it's good stuff. Everybody buys it. All your laser hair
See?
removal patients. get
Yeah.
that.
Yes.
All right.
But if should
And
put
You
cheap,
guys are
we can
welcome. I
adjust
asked
it.
for that.
Yes, thank you. The XD, oh, go ahead, were you asking a question?
Mm.
I was gonna say the XD with stretch marks, what do you think about that? I hear a lot of hype with that. Do you
they
think-
work great. I mean, it does work. I did when after I had my second, I had like 2 little ones. I mean, almost gone. Only I could see them.
Right.
But I
Right.
mean, you have to get them right away.
Okay.
What about old ones? Would that help at
Difficult.
all? Difficult, yeah.
You
And
might
then you can-
improve their skin texture though, because remember you're gonna make a little
Yeah,
collagen,
yeah,
so you're gonna have them see a little tightening effect.
Mhm.
It's temporary, so I wouldn't oversell it.
Yeah, no, that's why I know.
But like if you could do a promotion like new moms, like you know what I mean, like
Yeah.
something like that, like something that where you're educating the women that are just newly have
Yeah.
kids, where you can get them at that perfect time,
And how many treatments for that?
6
That's a lot.
it.
minimum.
Mhm.
That's with the old ones. With the
No,
old
like-
No, with new ones with the.
Did you
the-
try
It works though.
Infinite for stretch marks?
I've
We
been,
have tried it. I think.
Is that microneedling plus
Yeah.
RF?
yeah, the RF, yeah, I've tried it, it seems good, it helps tighten the skin, it just doesn't take the stretch marks away,
Yeah.
you know what I mean, and so that's the
So
hard
that's why
part.
the 1540 works well because we do have. Did you see the pictures on the scars?
Scar,
Yeah.
we've been
That's what I
practicing
was-
with, I've been doing a lot
Yeah.
of scars,
Yeah.
but I haven't seen any
So
results
this
yet,
works
so
very
now-
nicely on scars.
Okay,
You know, it will help.
Like
Obviously
all
not
scars,
like
like-
hypertrophic
yeah,
thick,
yeah, but,
big
right.
scars,
Mhm.
but I have people that come in that have like little mows on their cheek or
Yeah.
wherever, and I'm like, come in like a week after your stitches are taken out. Let me just
do
zap
that.
it for you.
Okay,
Yeah, 'cause
Things like
we've
that.
been- Dr. Raphael has been making us see like a bunch of people who've like they've had like keloids or hypertrophic and we've like kind of flattened them out with the PDL and now it's like all right, let's try this and see if it does
Yeah.
anything more.
Yeah.
Yeah. Okay. And then the difference between the XF and the XG.
So XD is deep, XD for deep. XF we call it like XF, like fast, super fast. The XD is more for deeper wrinkles. You can layer the treatment. So if someone comes in that's a little more advanced in age, has some fine lines and wrinkles all over her face, but has deep rhytids around her mouth, good area to do a full face XF and then go and do your XD over them around
More
the
like
mouth.
spot treat.
Yeah. You can do the whole face with XD for someone that has acne, pitted acne scarring because they're deeper. So you can use that instead. The only thing you want to be careful of is, although this is a colorblind laser, the XD is a deeper injury, so the skin will hold on to heat a little bit longer. So you wouldn't use that with caution in darker skin patients.
Right.
What about on the body? Would you use one versus the other?
I don't have both XD and XF.
Okay.
I have the old school one where they just gave us a 10 millimeter spot size, which is kind of in between the 15 millimeter. So I only have one. So from personal experience, I couldn't say, but I know that when we teach, I'll tell practices, if it's a thicker scar or something, then you want to use the XD. If it's something more superficial, use the XF.
Okay.
I don't know what practices are doing clinically, hands-on, because I don't, we only have one option.
Okay.
But I know that XD is very good for deep pitted acne scars. That's probably what, between that and deep wrinkles, maybe just spot treating, that's what I would use the XD for.
Can we combine it with Infinity?
I wouldn't do it the same day.
Yeah, I don't know if it's necessary
Maybe
to
rotate
do it the
with
same
the
day,
traditional.
but
Maybe we can rotate it with the Anthony.
this with the Max G is like probably an awesome treatment, right?
Yeah, so Max G plus 1540 in one treatment is a great treatment. You start with Max G, you do a full global treatment. So we'll do it on her.
Okay.
And then XF over entire face. Great treatment. So if someone they come in, it's their first time here, you'll get them so surprised at how good you can get their skin in just one treatment. So this is someone that has everything. They've never done anything cosmetic before. They're coming into you. They have a ton of sun damage. They're red a little bit on their cheeks, and they have large pores, fine lines and wrinkles. Never use Retin-A. You can do one pass of Max G, one pass of XF. They're gonna be addicted.
Is it about the same amount of downtime as well, or does it?
Yeah, so you're working in two different levels of the skin. So the Max G is only very superficial. It's working in the epidermal layer, just kind of getting the pigment, and your 1540 is going to work deeper than that. So their treatment overall is just going to look the same. You're just going to warn them that they're dark. If they do have dark spots, they'll get darker. So because people will ask, and especially with, I don't know, I mean, you guys didn't say you had Fraxel, but sometimes these companies, and I see it in the catalogs or in the magazines, that they'll say, like Fraxel will say, oh, this works for pigment, and I'm like, no, that's not what Fraxel's for. It's not going to address pigment. ICL is specific for pigment, and your Fraxel is for texture. So people get confused. And, I just like people to understand what treatment they're getting and why they're getting it, because I hate when they don't know anything. That drives me nuts. I'm like, listen to what I'm telling you. We're doing this treatment, so that when you call back, they're not like, I don't know, she did something, whatever, I don't know what you did, So I like...
It's like, how do people do
How
that?
do you
Like,
not know what's going
then somebody
on?
shoot a laser in their face and they're like, yeah, I don't know, something I have back 3
some
times.
laser.
Like,
Some laser.
If somebody has like a little bit of acne scarring, you're saying we could do it with the XD?
Mhm.
Okay.
We
And then
can
how many
do it
treatments will
with-
they normally see some result?
That's the same as,
Like,
anything else. Like with 1540, you're always going to do like probably 4-ish treatments. 3, 4, maybe 6. Maybe.
Okay.
and you're
Depending
talking about
on
like 4
their
to 6
promises.
treatments is like somewhat comparable to like 1 CO2, would you say?
It's an interesting, you know what? We never did a side by side like
Right,
that,
right.
so I would love to really be able to equate that. I don't know that I would say it's equivalent, because with CO2 it's a completely different
Right.
process, and you do get a lot more tightening overall with CO2 just because of the way it's vaporizing, the skin.
With the plus with this is there's no downtime.
Yeah.
Would you ever do a Max G, XF, and then the XD as a spot treatment, like if it has certain?
Yeah, as long as your settings aren't too crazy where someone, and I always listen to my patients. I always ask, like, how you feeling? You okay? If they're like, I'm burning, I can't take anymore, then, do it, You want them to come back. So you want to give them a good treatment. They don't want to be
Right.
scared. And we post-cool everyone with the, You guys have a roller?
For Zimmer. Oh, yeah, I like those. We had those.
Yeah.
in
The
school.
Zimmer is a
You
little
can put it in the
aggressive.
freezer.
Yeah, we used
Yeah.
to, like, when we used to do the ITL, we had like a cooling, well, we had the Zimmer, but then we would also fire, and then we had like a roll handpiece.
Yeah, I don't like the Zimmer on IPL at the same time.
Because then you don't get the heat. So
Yeah.
you kind of,
Yeah, so
that's
I
why
don't-
we would have the roll.
Yeah, I'm not a big Zimmer fan. A lot of patients, they hate that feeling because it's going up their nose, it's blowing their face all over. They don't. My patients don't like it. I don't know. Maybe they're high
Sometimes
maintenance.
when we had the Zimmer previously, I would treat without anything, and then
And then you
I
can use
would
it.
Zimmer
Yeah.
like as I went. It
Right.
takes a long time.
Yeah, yeah.
So just
I would probably just do it, like have them do it after, or do it for them after, or just give them a cool roller to just
Yeah.
like roll their face. The rollers are great. They love them.
Yeah.
Patients love them.
Yeah.
You get them on
Because they're
Amazon.
quick. Yeah.
Hey, you put them in the freezer.
Yeah, I just have them
And
on
then
the-
they come, they're like, oh my god, this thing is so cool, I want one. And then
And
you
then
can
if
sell
they do
them.
have like a hot spot, they can kind
Yeah, right.
Sometimes you can roll right before, like, laser hair removal.
Yeah. A lot of people use it for laser hair removal.
Okay, who is the photographer here?
You.
Paula.
What?
If she's moving, this camera also needs to move. Okay, I have to go, so I'm not gonna.
Can we listen?
Okay, so if she's standing or
Right.
you want to see the set up, you just turn this,
Got it.
you can do it.
Right.
Up and down. You see this? This is a gun. You see the gun here? There's a gun here to, and don't make noise because we need good recording.
Anything else?
Like that?
Maybe the mic, I come record it.
But yeah.
Also,
Sometimes I
Lisa
go back.
didn't have her cream yet.
Yeah.
Oh.
Who? Lisa?
Lisa?
She needs numbing cream?
Yes, 1 hour
Okay.
before
Someone coming
you're
in
ready
at
for
two.
it. So
Okay.
make a plan when you need her.
I have someone coming in. She has browns and red, but I think she's like working right now. So maybe can we just do like browns? What do you think she's gonna see better results with for this one treatment? Because I'm trying to sell her this.
What does she look like?
Like the metal.
She's maybe
you
a
like the metal?
Fitzpatrick
Yeah,
2,
it cools
3.
up quicker.
I would just treat her all over her face with one setting, and then
Just
the
the
second
next
time, yeah.
Okay. Okay. Because then that one she doesn't need to do the numbing and
No.
everything else. Right? Just
Yeah.
Boy, that, if you showed her pictures, this one,
yeah,
I
you
mean,
saw
it's
really good results.
amazing.
That's
Amazing
so-
results.
oh my gosh.
Absolutely.
Yeah.
Yes.
Yeah, because she didn't get brown at all.
I know, we were like, is it working?
Huge
Yeah.
results.
And how many weeks ago was that? Or how long
Like
ago was that?
couple
A
months.
month ago.
I got 4 weeks, yeah.
It's
She
probably-
did the
Actually,
Pico
not too
too.
long ago.
Oh, it was the same day as my husband's surgery. Yeah, 'cause that's
Oh,
why I
yeah,
wasn't
yeah,
here. Yeah, was it Thursday or Friday
It
or
was
something?
before you were even back.
It was before I was back. Right before I was back.
Do you want to do?
Yeah, let's.
Do you have
get
any
the party
questions
started.
or
I feel like
So, I think, yeah, we're good. But then we have another one too.
why? 2940.
Yeah.
It's ablative. Do you
Oh,
guys?
yeah,
Are you guys nurses,
I'm not using
estheticians?
that.
What?
we're estheticians, but we're allowed to do it.
You're allowed to deblate. You have to prep patients for that. It's pretty. It's aggressive.
Well, he couldn't even get the laser to work last time we were here.
Oh,
so
really?
Maybe we can first see
yeah,
that.
we can
Couldn't
plug it
calibrate
in.
for some reason.
Plug it in.
We can plug it in. You can plug it in. See if it works. Yeah. I would not on the first go do like a full global face treatment, and with the 2940 like just go crazy like
Right,
that.
right.
I would do like, what you could do is you could do a 1540 treatment and then just do around perioral just with that handpiece and just kind of go, it's a grid. So you would just, so that on that you don't want to overlap too much. I think it's an oval, it's an optic. It might give you a square.
That's
I'm
my
getting
one.
confused. Which one do you have? The blue?
I don't even know.
You don't
because
know.
We didn't play around with it before.
So, I would just not have much overlap and just go literally around the mouth.
One pass.
One pass first. You have to use this on people that are pre-treated. You
Yeah.
can't do this on just anyone. They have to be pre-treated. I wouldn't do anyone over Fitzpatrick 3 to start. And then as you do, like maybe just around the mouth, you see how they do, then you can go to someone, it's it's ablative. They'll walk out, they have active bronzing right away. Their downtime is a good 3 to 5 days. When practices have a CO2 and they use the CO2 well, because we can manipulate CO2 lasers to have that light downtime treatment, the 2940 usually gets kind of pushed off to the side, because you can do a CO2 treatment and almost give them the same exact downtime doing a light CO2 treatment.
Yeah, see, we don't do the CO2, but
Yeah.
we have worked with the Pixel 2940 before, so like
Okay,
we're
so
familiar with
it's the
it.
same idea.
Yeah, but see, we would like stack the pulses when we're doing it with the Pixel.
If you're comfortable with it, then
Right.
you can do it. Then do it. You know,
Right.
just make sure you're telling your patients what the
What to
downtime is.
expect,
Yeah.
yeah.
I mean, like I said, they're down 3 to 5 days. What were they down for the Pixel?
Yeah, about 3 to 5.
Yeah, yeah. And they're using the Aquaphor. They're
Yeah,
getting
and
all
the more they do it, I feel like the downtime kind of gets less.
right,
actually,
right.
So, but then I kind of think, like, I guess because this is ablating the skin, so again, that's the difference between this and the 1540.
Right. If you have someone with
Person on your schedule is here.
Hi, she's gonna do the next streamline.
Okay.
Right, let's see.
Yeah, just give us like a.
That's totally fine.
I just saw her, like
Doing
20
her
minutes.
first.
You-
Will we
you-
do
this will take 20 minutes.
Yeah,
tops.
like 20 minutes. 'cause
Oh, I
she's
already have
already-
her. Would she need like pictures and stuff?
You
Yeah,
can
do
tell them Vizio. But
Okay.
that's it. Thank you.
Yeah, so I would say 2940 if you have someone that, let's say, a woman that has an event coming up, wants a little more than, they don't want to do
Right.
the 4 to 6 treatments or 4 treatments of 1540. They'd rather get it over with 102 treatments than use your 2940, yeah.
And they're okay with some downtime and everything.
Yeah, and just, pre-treat them for at least 6 weeks with some retinol
Yeah,
and
well, the other nice thing
hydroquinone.
about the 1540 is you can treat everybody, right? Because it's colorblind.
Yes, with 2940, no.
It's
Yeah.
just
Wait,
one.
you
And
said-
that's 1 through 3. You could do a light 4, like my skin you could probably do with it. I'm a light 4, but it would have to be like in the winter, dead of winter months, pre-treated.
That's like
And
Dave Rose
post-treated.
for me, though. I should really.
Yeah.
This,
So you don't think we should use it past Fitzpatrick 6 with the 2940? Because we use the Pixel on Fitzpatrick 6.
And they didn't get any post-inflammatory
I mean, we
hypertension.
pre-treat them, but never any problem.
Alright, well, good.
With
Thank God.
caution, but yeah.
Yeah, I mean, you know your patients. If they, if they can tolerate it and they've been on skincare treatments a while and they don't have any issues with
Right,
it.
but again, we also have the Infinity, so like I would never probably even recommend the Pixel. You know what I mean? When someone who's a 6, if they can do the Infinity.
That's only because she couldn't come here.
Right. Oh yeah, you're
But-
different because you're in the city.
Okay, sorry. I just wanted
Yeah,
to
no. So I mean, I've seen people have some disasters with 2940
Mhm.
if not used right. So that's why I always say, like, if you're gonna, I mean, people use CO2 on dark skin. I have a friend that she does CO2 all day long, and she's doing things I would never do with a CO2. But that's not my thing. I'm not as comfortable with that. I mean, I do CO2 in the OR post procedure, and it's we usually do 1, 2, and 3, and that's it. So, but everyone's when
Right.
you're comfortable with something, then you go with it. But just know what you're getting into.
Okay, cool.
All right, so let's wipe her down. Take all this numbing off so that you can. Do we have any ice?
Yes, we have ice packs.
Yeah. Okay.
Excuse me.
Let me go grab some.
All right, let's see what this camera's doing.
We don't have
And
ice pack in
do you
here.
have your 2940 hand piece?
No, but probably right now, laser.
Yeah, or the 1540, you mean?
I mean, yeah. Oh, all this 2940 stuff. I'm getting confused here.
But we'll do the Mike G first, right?
Yes. You want to hop up?
So we've been getting like a water low, fluid low
025,
thing.
024
Yeah.
Yeah.
Just over and over again, even though the water is
So
like,
first check your hand.
That it's in.
Yeah.
all the way.
This is you have to like wiggle it.
Yeah. Yeah, that's what I did, was just kind of like play around with it a
Yeah,
little bit.
usually it's from here.
Oh, okay.
Yeah.
Yeah, because the water was totally.
If the water's full, and you're still getting that 024, yeah. So it's here. So what I like to do is,
At least one yellow's left.
so I undo it, and then the way I like to put mine in is I put from the back first,
Okay.
and then you have to like do this wiggle.
What do we need to do around?
Don't we need a pad for her? Like they have nothing in these drawers.
Yeah, go grab some from the other rooms.
Have a spatula.
So do you want to
take
ice
it off or just
before we
alcohol?
start?
No,
No
Yeah.
Wipe it
pre-icing.
and then,
I'll get a drink, there's not right now.
alright, right. You would get a couple.
Yeah.
So we take this stuff. We'll just take it off.
Well, I'm gonna wipe it off dry first. I feel like it works better like that, and then put the alcohol. But your skin's clean on it.
Doesn't it?
You can see where we didn't treat it.
Oh, you did.
Glad you went over.
Yeah.
Do you have, what do you use, the metal goggles?
Yeah.
If you get the stickers, sometimes it's better.
A little bit closer.
Yeah, because you can pull the skin down and then you can get inside.
Yeah, we'll try to pull this down a little bit further.
Yeah.
It looks so good. It's just more easier.
But, and the pixel, like.
And I'm telling you, there was no response.
Yeah.
Like to where we were calling the people that like, you got the machine from me, like, you sold us
Wow.
a done.
But she had.
But then my chest burned. And then, yeah.
Oh, did you,
See?
did you do?
Well, it's fun. But like, it was.
Sometimes that's filters also. Have you ever changed your filters?
Yeah, I mean, we just got it all serviced right before we got the machine. Like when we got the machine, before we even used it, it got serviced and they switched out all the stuff. Or at least they were supposed to. Yeah, I'm trying not to touch anything in the drawers for like Dr. Bach, you know what I mean? So I just brought in a bunch of stuff. Which
I can go to auto trash. Yeah, so wipe that. Use these.
Are you comfortable?
Do you have a minute for me?
Yeah.
I'm on my one request.
Do you want a stress reliever? Or your
Yeah,
this
sure.
usually ball?
No, I'm good.
I already
Thing
took
is,
this
here's
so
trash.
well last time.
Yeah.
It looks so good. It's so much brighter in the box or something.
The other thing you want to do
There you go.
is I would,
Thank you so much.
you want to use the boom, which is this thing, right where it comes out.
Oh, we lost it.
Don't worry about
Right.
Right where,
Sorry.
Slide up a
Where it
little
comes
bit.
out
Yeah,
on
just
this
get
side.
up.
Because if you do it out
Slide it
here
down a little.
and it kinks,
Weird.
like let's say this falls and kinks here, what happens is eventually this will break down
Oh, yeah.
and you'll start to see the wires.
okay.
So always have this up
That's
here.
it.
Remember that always happened to me.
Yes. Yeah, that's it.
So what settings did you guys use last time? Do you remember?
Just so I can see.
I thought it was 15 and then 20.
Are we doing the Intel thing?
Now we're doing 20, right? Just 20.
Well, I would like to see what you did before, just so that I'm not giving her less of a treatment.
I think we did, what, I thought,
We can see it in the chart.
so we're gonna do the Max G first.
Yeah.
We're gonna need the lotion.
Yeah.
Do you need me to sit up further or?
You're good.
Without it's chilly. Actually, should I be putting that on my hand, that lotion? What? The lotion, or should it go on gauze?
I put it on gloves.
I feel a lot more numb this time because it kept on longer.
So maybe it'll be better for you.
Yeah. This time was about half an hour.
Is it giving an error?
It's a water error code. Usually it means that the water is not feeding up into the handpiece properly, and it's usually with the hand, with this connection here.
So what do? Just take it out and try to put it back?
You usually have to kind of wiggle it, but what happens is you want to hear always 2 clicks, and I'm not hearing the second click.
That seem like enough? What's your first name again?
Nicole.
Nicole.
Yeah.
Okay,
Yeah.
camera on Nicole? We need the camera on Nicole.
Look it up.
Really? I had to my motivation.
That's what I told her, yeah, they're wonderful.
Oh, such a lifesaver.
What'd you do? Brady?
Oh, the right
Really look nice.
Thank you.
You did a good job.
It's not bad for me. Like playing Sammy,
Who?
the guy from New York.
I do want to use
I think
this.
about doing it also.
It's,
I'm
yeah.
like new to doing
It's
it.
such a slow saver.
Yeah.
There's so much time to like on for I wrote them during every like national and it's not like a tattoo, you know, where
So pre-treating and post-treating,
Yeah.
Yes.
what do you usually use? Do you say you do it with
There's something
everyone?
on here, but I don't
Just
see
because.
If someone just coming in for IPL, I'm not obsessive over pre-treating them, but I'm more of like a holistic practitioner where I'm like,
do you want the good dinosaur? I'm about
to run. I'm like that. I take care, if you want to get rid of your spots, then you gotta take care of the skin. You know, like if you want to lose weight, you go to the gym and do a diet, you know, so I'm very,
It's like huge.
I was doing this yesterday and then literally,
Yeah,
I'll
that's
go get
just
the
the way
water,
I
but, and then it was like.
you know, everyone's different. So, let's see there. It was the click I was looking for.
Oh, we got it?
You know, it's supposed to click in both sides. You'll hear like click, click. But I don't, you know, sometimes when they come used, they come worn down. So
Right. So we're not
you're getting an
clicking.
error code on fluid, and it's not your fluid. Whenever you get this error code, 9 out of 10 times it's the handpiece not being
Not
in
the-
properly.
Okay.
Because it's what it's looking for is in order to cool the tip, it has to call for the fluid to enter the handpiece and cool the tip. And that's what's not happening.
I have water. So yesterday
Yeah, I
put in
know.
some water and even though.
But there's water.
I
There's
know,
water.
I know.
It's not the water, that's why. It's the handpiece.
And then I would just put like a little bit of water in and then after about like 5 minutes I would restart it and it would
This
work.
was all day yesterday?
And Marina had the same problem too. Apparently, I didn't know she did. Not all day, but then it would work, like out of nowhere.
Yeah, that's stupid.
I know.
I would have the guy that sold you the laser readjust the pins so that they click right. Because it's for sure the pins.
Do you want to try to put water in or no?
Because it's full.
Yeah.
It's all
Think
the
it's
clicking.
too full?
No, it's.
No, I think it's just, it's the handpiece. It's like, usually it's like,
Just
just a click. Not getting that. Let me just try again. All the pins are in.
It's not working, people on their own.
Your number.
Okay, what's going on?
It's gonna, yeah.
Yeah, well, thank God yesterday was like my patient first one, actually.
Do you have to do this a lot, or are you putting water in it when it happens?
I put a little bit of
Shaking.
water in just because like it told me to, but I mean, I knew it didn't need it, but I did it anyway.
Let's see, hopefully we can try that if all else fails, but it shouldn't.
And what I always tell my patient when stuff like this going on, the laser won't work unless
Yeah,
it's,
yeah, unless it's working
perfectly.
That's
Don't worry,
laser
it won't
spray.
be.
Fire off.
Yeah. Sure,
Let's try the 1540 and let's plug
Yeah,
that
that's
in
what also
just to
did,
see.
is just like trying different hand pieces.
And was it getting the same code?
Well, I tried the Y because I was doing the chest too, I was doing the face and chest. And then it did it with the Y like once or twice, but then it worked. Right, like with the G. But then after I did it with the Y, I put back in the G, did it once or twice, and then it worked. It was like weird.
Yeah, they gotta fix the problems like that. Yeah, it's taking longer. It's calling for the water, it's just not happening. It's not coming in. Alright, let's try a little water.
You want water?
I mean,
Like,
Oh,
I
is
know.
it too, what you may
It
say?
wouldn't be too full, no.
Yeah, it's weird, right? Do you want to
It's
try
all
different
from here.
hand piece?
Yeah, in a minute. Let's try this. I'm gonna throw that in this one. Sorry, I didn't direct you. That's good.
What is there a difference between these two?
No, but this chamber was like totally full.
Okay.
So there's, I don't know why they used to. This machine used to only have one chamber, but then I guess they made two. I guess they couldn't fit it. I don't know. Okay. And you said your filters are new. Those are the three things that the 024 code. It's either water, filters, or
I mean, they're supposed to be, and
connection.
we had somebody come in and service the laser before.
So it should be fine.
and this is all.
Because how often are you having to do that? You said like
Every
6
6
months.
months.
Yeah.
Oh my
And
God,
we
yeah,
haven't
every
even
time.
used it. We've had it for like a month. And we
I've done
haven't
it
used
almost every
handful.
treatment.
No, the filters.
filters.
Oh, the
The
filter.
filters, I mean,
Once a week.
I've probably gone a year without changing
Oh.
filters and that's
Yeah, yeah, yeah.
fine. 1, 2, 3, 4.
So any other things that I missed?
You missed a whole bunch.
Everything.
It's on tape. You can watch it tonight.
She was asking about the.
You're actually on it right now?
So what would happen if you did max G treatment and then you did one pass of XD on the dates? Wait, what happened?
Use brake treatment.
Really? Okay, good. That was my mess up.
Oh,
That's fine. As long as you start with the max shade, yeah. Yeah, because you wouldn't want to add heat into
I
your.
feel like this is going to be the winner. Let's see, ladies. Fingers crossed.
Alright,
So
let's
what
try
I
the
do-
other hand. Yeah, you
so
try it. Maybe you guys
all I
haven't touched.
do, I just
You keep
constantly
restarting?
do, I restart it and
I
it
had
I've done it
jiggling
like
these
5
things.
times
Do it,
and then,
do it,
I don't
yeah.
know, I don't know.
Same, like I
Pick
kind
your
of like
poison,
just
you.
like,
It's like annoying.
Try it, yeah,
But like
absolutely.
one time I literally, all this was full, I did
yeah, I was
this.
like doing this.
Yeah. Be careful if you ever go and try and take the filters out and your chambers are totally full, you'll start spilling water all over the place.
I wouldn't take them out, I just like
Yeah, that
twisted
was
them to like kind of see if
Just an FYI, I've done that.
And
before.
even sometimes like this is not always clicked in. on
Yeah,
the
that's usually what it is.
Yeah, and I've done that, I'm like, okay, it's all clicked in, and I literally have to do this like 4 or 5
You know what, it would be
times.
kind of like after, like I put the water in, it would be like 2 times after, so I don't know really maybe if the water's not like, I
No,
don't know.
I think it's, I'm telling you that it's this, because, I mean, I've trained on hundreds of these machines, and in a brand new one, you literally hear a click on one side and a click on the other
Yeah.
side. It's like click, click, and then it's it. Whenever, so believe it or not, usually the hardest part of my training is showing people how to put this stuff, the sand pieces in, because it's so annoying, yeah.
It's the worst, that's the worst part.
Yeah. So this is the code we always get, because I show people,
Try
like,
to
you know,
take this out and put it on again?
I've done that
Yeah,
like
You've
10
done it.
times.
Okay, I know,
Let's
that's,
try the other one.
try the other piece.
Yeah.
Yeah, maybe we
Okay.
can try the other piece.
Yeah.
Let's do one more time.
Or
You're
even like
ready,
the
right?
Max Y, so we can at least just treat her face or something, you know?
But have them come in and fix that.
Yeah.
That shouldn't be
Well, we
happening.
weren't getting it at first, which is weird.
I got
And,
it
like,
the
we
first
weren't
time
even-
I did it.
Oh, you did?
Oh my God, yeah. I had the water, I was like in a panic, and then that's when I did the mess, I wanted to do the 1540 and the XD and 6, I was like, what piece do I use, what piece do I use? And I'm like, circle or square, Val, river, Val,
Which would be flip a coin.
So what should I have done if I wanted to do that XD treatment, if I really wanted to do it on her face? How many passes should I have done after the XG?
You could do two passes. I mean,
Okay.
I would, it's just not comfortable enough to do 3 or 4 passes,
Yeah.
you know. If someone can tolerate it and they
She
can do
seemed
it.
fine, like I was like, really, you're good? She said, oh yeah, I had way worse before.
What was her
Yes,
goal?
yes,
What was your
like-
goal? With rank D?
She had a lot
I'm
of
gonna get the
redness,
Max Y.
and I also wanted to do skin tightening and just, just texture stuff, you know?
Mhm.
But I would have probably used the 1540 on her instead of the.
So, if you want to attack pores more,
Mm-hmm.
XF round.
Mm-hmm.
If you want to attack more deep wrinkles, acne scars, XD.
So what say somebody who comes in and she's, you know, let's say they're in their 60s and deep wrinkles, do you think I should just do the XF instead of the?
You can layer.
I mean,
You can do one of each.
Oh,
You
really?
can do XD and then XF.
How many passes? of
One.
each? One pat, right, okay. Wow, that's pretty good. And
Yeah.
would you even do the Max G at that point?
If it had pigment, I might, if, you know. if
Could
they
you do
want-
all three then? That's a little
I might not
much.
double pass them, because it'll just be too much for them.
Where do we,
Yeah.
I just want.
Um,
But I meant like do the Max G, XF,
And
XD.
Yeah, that's what I say,
Oh,
I might not
right,
double
right,
pass the,
yeah, yeah,
the
yeah.
1540.
Okay.
But if she had a lot of sun damage and pigment or redness and wanted to see some pore improvement or texture improvement, then I would.
Does anything look like it's messed up with the hand piece?
No, because the pins are fine, I just think it's the connection and maybe something's loose, I mean, this is not my specialty, I don't. I try to troubleshoot
Yeah, it's
as much as
weird
I
that
can,
it's,
but
but I feel like
I have
since
no
we've gotten
technical-
it, I've had trouble with it.
Yeah.
it's, yeah.
And always
it's
that
for
hand
the
piece,
inside.
none of the other ones?
No, because I had trouble with both hand pieces yesterday.
Oh, really?
All three, actually.
Oh,
So
really?
it sounds like it's coming,
Yes,
From
see,
the
that's-
scent.
This should work, hold on, I'm gonna. I just heard it nice.
This is really for the body.
Yes. You could use it on the face too, but
It's just bigger.
Max G is good.
This just looks like it needs to be cleaned
So
up.
there-
Before you put it on her face. Looking out for you, Mindy, looking out for you.
All right, so we put the Lux lotion on her.
Yeah,
did.
someone did already.
Would it be dried up?
No, how much? I always get so nervous.
You wanna see a little glisten?
So you think
Yeah,
about
I like
it?
literally pour it on the
I-
face.
Do it again?
It's not like ultrasound gel, this is what I usually do.
what is it, just for pass?
It says it like a doctor, yeah. You definitely want, you get a better treatment when you have a little bit, so I do it like this. I pat, you see how now you can see like a glisten? So I just pat it. And then I can see, like, I like to see a little glisten.
Especially if their skin's dry, I feel like it like soaks it
Yeah,
up.
it does.
I do like it though, because at the end, it's like, you know,
You don't have to, yeah, you don't have to wipe it off. Unless they're acne very gel.
Just need the-
Let's try again.
So I can't even.
But first you don't succeed.
Try 100 times.
Yes, try 84 times. And make sure it's on tape.
Yeah, then we continuously try. What did you do, Dana, on you?
So we did the Max G on my chest. I have no idea what,
Settings you were?
but I think that the skin tone maybe read me like, I know you're
Lighter?
gonna say no, but like it read me as like a 13.
And,
When
okay.
really like I'm 100% Italian, like I should be higher than that, wouldn't you think?
But it's literally
Beats me.
looking at your melanocytes.
Yeah, but
Did it
I
work?
mean,
Did you get a good result?
She burned, right? A little bit?
well, you don't see anything else.
No,
Thank God, it
it's
like
good.
like you know I was putting stuff on around the clock, but I was like blistered that night.
Oh, you were blistered?
Uh-huh.
Did you post-school yourself?
Oh yeah, I had ice on it, everything.
It looks good.
But yeah, now look, but I didn't really have like a ton of stuff on my skin to begin with. That's what else was weird. It wasn't like I was like one of those people that just has like,
A lot of it.
you know what I mean? Like I don't even think I noticed the difference.
No.
Well, I
don't
Yeah,
think
like
it
that
is.
sounds
Yeah,
a
'cause
little
I mean,
like
that
that.
looks good,
Yeah.
but you must, like.
Yeah, I
you-
mean, I didn't think I had a lot, you know? And it was
Right.
weird, it was just like the one side versus
One
the other
pass.
side. One pass,
Maybe
'cause I was
the-
dying. And I thought something
Was the
wrong.
technique, were they pressing right?
I don't know,
Yeah,
there
like,
was
watch
people
how
that
it's
did
pressed.
the-
Yeah, you have to, like,
Wanna be like.
I like almost press.
Yeah.
You know, like, I'm like,
Yeah.
yeah, so you have to press.
Okay.
If you're not, you're arcing, and that's why you're probably.
I usually, how I started doing it, or how I was taught, was to roll.
No.
And not roll to like make sure all
Oh, to
four
make
corners,
sure all
and
four
then,
corners are
yeah,
down.
like, because
Yeah.
someone will.
Or just like,
Yeah.
Perpendicular.
press it down.
Yeah,
Make sure you see your square when you lift. And then you know your overlap.
right.
Yeah, so see, I feel like I've been.
And you're saying 10%
I
each way.
treated this woman yesterday on her chest. So your chest looks good.
Yeah, blood fluid.
Same
But I
thing.
think I saw more than that.
Same amount, right?
But I'm so nervous. It was
Well,
burning
what
me
settings
off.
were you on?
So with this,
Oh,
there's
okay.
like a 20 ms and 20
Let's do
joules.
what she
And
did.
this I did 30 ms with like 36 joules on her face with the Max G. But I wanted to do more, but I was
You drank now.
you know,
Did you just use some extra?
use the Y on her chest. Yeah, I know, but I don't see nothing.
Oh, yeah?
Did you treat her neck at all?
Um, No.
Okay.
I mean, like, I kind of
That's
like
far.
this here. She doesn't have like.
Yeah, I'm by the
Yeah.
airport, JFK, or like I'm on a beach, facing on the beach, so.
Do you adjust your settings for the forehead?
Sometimes.
I always did, I don't know about this machine. Do you recommend adjusting your settings for the forehead?
If someone has a lot of sun damage, the sun damage will be worse on the forehead and it's gonna be more painful, so if someone's a little more,
Yeah, we always used to like knock it down.
knock it down, yeah, you can.
But I've been noticing with this, like, and again, I don't know if it's my technique, but like, I keep on seeing them get the pose like right here on their cheeks. Now I know obviously like a lot of times they have more damage on their cheeks, but like I'm seeing like just like the line, not necessarily like
swelling?
square, yeah.
Yeah, so that happens because this is very powerful IPL, so they'll get that like under eye swelling from, you know, especially if you're using like a 15 millisecond pulse width, you'll see that.
Yeah, it freaks me
It's,
out.
it's,
But really just like right here, like it looked like I did
Yeah.
something wrong just in
yeah,
that
they'll
area.
get a little, like, almost like a little welty.
Yeah.
Yeah,
And I'm like,
that's normal.
see you on your way.
Has anybody called?
No, yeah, fingers crossed, like, you know.
Just post cool them.
Yeah.
That's like the biggest thing.
Yeah, and it would calm down, but like
Yeah.
it'd still be kind of a little
Are we
bit.
on?
No,
No,
I'm just doing what the other girl said to just keep,
Marina.
Obviously something's not right though.
something's wrong.
Yeah.
It's with, it's 100%.
But it was doing
yeah.
this and it was working eventually.
Probably
You're doing great, Mandy.
It's doing mom.
You're doing great.
What?
It doesn't work.
It's
for you.
invisible.
Yes.
Just if you feel it, you got painkiller and tsunami.
She's doing great colors too, yeah.
Yeah, she said
A
she
good
did.
painkiller, yeah.
Yeah, so you're having a little fun.
Yeah.
That's fine, yep.
Yeah, and as soon as I saw the thing, I was like, I was like, I gotta start firing it right before, as soon as it showed up like the regular screen.
No, this is the longest it's ever gone.
Yeah, this is like, I mean, yesterday I did it a bunch, but like, once I
Yeah.
switched the hand piece,
You
it
were
was
fine.
like, yeah. I mean, I had to do it like twice, and then it was fine.
Is it not working?
Still.
So what do you think it is?
Yes.
We have
I think it's right, it's in the connection here. I'm pretty much positive.
And you guys haven't had to do this?
Let's try, after this last attempt here, let's plug in the 1540 because it doesn't drive up as much water. So we might be able to use that. So let's turn it off for a second.
Yeah, I did that a couple times too, that might help, I don't know.
I'll show you the picture.
No.
Right, before that.
I've been doing this.
So would we do an XF or an X?
D?
I'd rather do XF. She doesn't really have much.
Yeah.
It doesn't matter.
This lady.
How do you store all your hand pieces? Okay, we have that.
Let her put on the wall. Or I mean, you could save the foam pieces that came in the
Yeah.
boxes and like put them in a drawer.
Ah, that's a good idea.
I think it's.
Oh, I wanted to come
in
in
so
so
bad. You can see
bad.
like the fat like coming out. Wait, were you here?
What happened?
What?
We're just
Yeah.
Did you get to see it?
Yeah,
I didn't get to see it.
It said
Yeah,
they've
have you
gotten
seen it?
them.
I was so
coming
mad.
so
I
bad.
just
Yeah,
saw
I
like the
couldn't
yellow stuff
come in
coming
on
through
the
the
next 2
tubes,
days.
and then it got red, and I was like, they're like, oh, we're trying to stop.
Here's
It's
the,
Oh, that's awesome.
It's
No,
really cool though. You see like.
doing that
Yeah,
whole.
but then there's like nothing on the surface. This is like a little small hole that you put, and then you just put this thing in.
It doesn't even stitch, right? Does he stitch it?
No,
No.
I didn't staple it.
Yeah, so cool.
Did you skip
Like
fast
this.
somehow?
Yeah.
That's what she was saying.
Yeah, I think the
Did
one
you
that
take
he
that
was
through
doing.
the surgery?
Huh?
Did you take the surgery?
Yeah, everything is
I was in the middle of an aircraft.
What was the problem?
It's the same thing as yesterday, that flow of fluid thing. But she's saying that she thinks it has to do, Nancy, this is
Yeah,
working.
so it's definitely that. So the reason why it's happening is because your IPL handpieces, for whatever reason, the connection's not enough that it's calling for the water, and not enough water is entering the handpiece to cool down the tip. So have them come service that.
The
All the IPL handpieces, the same thing's happening, and it's because you're typically with this machine, when you plug in your handpiece, you hear like 2 clicks, one on the front prongs, and the second on the back prongs. If you don't hear those 2 clicks, it means it's not really in. So when it calls for the water's not coming up to cool down, and that's why you're getting that water error code. Because obviously there's water here, doesn't have water.
So the way
wrong
that
with
you
the
connect it
connection.
now,
Yeah.
you cannot play with it in a way that it's really
So we tried how many times?
Oh my gosh.
Like 25 to 30.
For a good half
I
hour.
have the, right now I have nothing more than that to offer, right?
Yeah,
Right.
So we're gonna use this one in the meantime.
Do we want to do this one?
So this one is good.
This one, that's right.
Yeah, I was like, no. Okay.
No. We finally got it.
I know.
What are we doing?
So this is, we're gonna have to, so Andy, we're gonna have to skip the first part of the treatment where we work on the pigment just for today, but we'll bring it back in another day to just finish it out. But we're gonna do the second part where it's for like the texture and everything. Sorry.
Are we doing the 1540 then? So we're just. doing
Yeah,
the
because this is the only one that's working.
What about?
So that's what we're going with.
That's where we're going.
Now, do you use cooling the Zimmer for this?
No,
Never, you never use it. I'm gonna bring these in.
I just post-cool them. You don't want to pre-cool the skin because you want the heat to go in.
Right.
You don't want the top of the skin to be cooler. You want this heat injury to penetrate. So I wouldn't use the Zimmer until if after you want them to hold it, that's fine.
So the Max G we're not using at all. This is more for like texture.
Yeah, just because we don't have.
Numbing and all that other stuff.
Hmm?
She'll probably need numbing
Cool.
with this.
She has some.
Oh, right, you have your patient. Yeah, I mean, let's wipe off some of the Lux lotion with a little bit of alcohol, because now we don't need the lotion.
Okay, maybe go. And then will we do this skin towel?
No, so skin tell you don't need for 1540, because 1540 is color line.
Oh, God.
Are we getting rid of all of it? We don't need it for
Yeah.
this, right?
There's
You don't have the
Unless it's under her. Okay.
Alrighty.
Who's gonna do it?
I guess we're all gonna take turn, yeah.
You guys have glasses? I have.
You have some, they're fine.
Yeah, I'm sorry. I wouldn't do that just because you want to be able to get close to her eyes.
Oh, alright, so we're not, okay, because I know the girls usually.
You can pan it. The closer you are to their eyes, the better the.
Yeah, I like,
Fortunately, eyes.
we'll have to ask for the shield, I like that.
Yeah, the sticky
But,
ones.
yeah, sticky ones. Just because you can kind of put them exactly where
Yeah, and you can
everything,
pull the
right?
skin down around it so that you can really.
We different. Alright, so which glasses do we need? Any of these black ones?
No, those are IPL glasses. You need laser glasses. So it looks like this here, and it must say the wavelength on top.
I think it's like the generally.
No, generally it would probably be just 1064.
Where are all the glasses? This is like where that's another problem.
What that look like this? You don't have one of those. Okay, don't use this laser.
Yesterday, I met somebody that I know.
This one will.
friend of
I
mine,
feel
she's
not
been doing
going.
laser for years, she's got adverts in her eyes.
This will, because it's water target. If you get, and it's a laser, so the laser's gonna really disperse. It's not worth it.
No, no.
I IPL, not so much. IPL, you could really get away with it. You could blink, you know, but this, no. You don't want to mess around.
Any other?
I mean, we'll just talk about,
Yeah. Should we just do a couple people at a time in here then?
it's your.
I'm not gonna do it.
I'm off the record. I'm not really a
I'll try
sinus
and I
trainer
can-
right now, so it's up to you guys.
But I'm not gonna stay in.
But-
Should've really
So
been-
whoever is not gonna do, so obviously the person that's doing the treatment will have control and blink, so I think that's easier to do.
Yeah.
Otherwise, someone else will have glasses, and then the other person just don't, the beat.
Okay.
Okay.
So who's gonna go first?
Who's gonna
I'll do it, but you're saying I don't need to wear glasses?
If you can confidently
No.
blink.
I'm new, so I'd rather have extras out.
Yeah, I mean, I'm wearing my goggles because I'm touching
Okay.
my eyes. I have a baby on the way, so I, you know, I'm like, I'm not taking any chances. And this is, laser is not a joke. Yeah,
So what are you
IPL,
gonna do?
I don't care about, but
And then I can leave, I'll leave or whatever.
those won't.
But I don't wanna, I did that last time I played.
What do we, I mean, we have a whole bunch of different ways of glasses here, so what do you?
750 is because it's for IR. And 75. It's, the target's water. They don't have water around the cornea. You're not. I made them wipe it off. Those you might be able to just, you know, wait.
Better.
You want to get you more, yeah.
No, I can get another 10 minutes. I mean, I can
Jeez.
Going downhill quick.
This is really going downhill quick.
All right, so I brought in the,
Oh, yes, that's what we want.
yeah, so
That's probably the easiest way to.
Mr. XG, do you use the skin tone on this?
No, because it doesn't matter. Okay. No, this is just- You guys should probably just take these out anyway. Take these out so you can have them in the skin out for removal.
How far along are you? Are you doing
Feel.
How far away from me?
Oh my God. Gosh, it's the worst thing.
And how many do you have already?
Oh, you
Oh,
have two.
really?
5 and 2.
I feel
I
pretty, yeah.
6 AZV.
I'd say every day I'm a one and done.
And do you think you're done?
I think I'm a
How
one
many
and
do you
done.
have? One done?
I'm done.
Oh, no. I'm an only child. I hate being
My mom's an only child. We
Yeah,
didn't
actually, you
work.
look like you got like.
Yeah, I know, I think they're all
Don't do that.
overrated.
Don't torture
No, I
your
just kid.
No, you need at least somebody to like shove them down the basement and close the
Yeah.
door so they have somebody to.
You know what? You know what it is?
And it's supposed to be careful.
And you, when you get older, like now, I'm not older, but you know, I'm almost 40, and you know, know, life changes and things
Find your
change
sibling.
and like the fact that I had like, I'll never be a maid of honor. I mean, luckily I have such good friends, but a godparent, you know, like all those things that like you really miss out on. Like, it sucks.
Yeah.
Well, yeah, it's like me, I'll never be, 3 boys and
Yeah.
so I totally get it.
But, you know, look, you're grateful in one way, but then
Yeah.
like in another way, you know.
But I have a sister and I just realized.
Yeah. That's why I do like it. So my
Your brothers, you have 2 sisters and a brother.
cousins.
Yeah, but you think, but then when they had their siblings, you're always kind of left out. Somehow. Don't use 1540 for the last one.
Do they say?
I don't even know,
Yeah.
What do you think about the kids now that you go for classes?
I don't know because I don't have one.
Oh, you don't think it works? I've seen it work. Awesome.
What's that, idea picture?
Yeah.
Beautiful.
They're good.
I'm gonna have to try to play around with it.
And this is for
You
your
see it like break off the back of the school, but they need to do it.
How many?
I mean, at least 4, but like I had somebody
And
4,
quick.
yeah, in a row.
Yeah. You just spot it.
No, I did her all day. And then now she's got going on a series. But like it still looks better than from what it was, but you know, then she kind of like slapped off for a little bit in the
Yeah.
summer.
That's
blah,
good
blah, blah.
because if it's sun.
Let's just go to 1540 so that you can see what. So, I mean, you can copy them and then cut out what you're going to use for. So like, so it tells you what the indication is.
Okay.
So this is 1540 for skin surfacing and coagulation of soft tissue. Pretty much you can ignore the coagulation of soft tissue. That's only when you're combining it with the 29. So what happens is you can coag first and then go over with this, but that makes for such a more difficult treatment. So if you're going to use your 2940, I would first do your 1540 treatment and then spot treat it with your in areas like under eye, outside of the rim, or around the mouth, or like some of these,
2940?
yeah, or like some of these lines that people get on the side, and then get comfortable with it. And then you're used to using Pixel, it's essentially the same thing, and then you know how you fish.
Same kind of outcome as a pixel.
I don't know the Pixel, I'm not familiar with the Pixel, so I wouldn't be able to. It's
Yeah.
2940 wavelength.
Oh, yeah.
What's what power?
Power.
Yeah.
So you're dealing with the same thing.
He might have gotten, you know, bought the laser and just took on the hand piece
Yeah,
that they
that's
had.
exactly what happened.
So,
And plus the Pixel, we have the, you know, system over it, so it's kind of like.
So, okay, it just means, I thought it was like so much.
More difficult.
Yeah, it's not, okay, so it
not.
should be
Okay,
fine.
so-
the main reason why a lot of people don't do 29
Because they have CO2.
if you have CO2, then you're probably more aggressive with your CO2 and you're almost at the same downtime. And, you know, this is so different. Like the 1540, we're not, there's no downtime, you know? So, if your patients are willing to do a little bit more, then you can use the 2940. It's a great treatment, but you have to stick with it. So these are your stretch marks. Melasma, if you didn't, don't hide. Stretch marks here you're setting. So they'll tell you, like you can do XD. So you have XD and XL.
Yeah, I was like, what is that?
Yeah.
Okay.
This is the way, so like of course they have to use everything.
Who's the joint?
When I first bought the machine, they didn't have XD and XL. So instead of changing the whole manual around, we have just a 10 millimeter tip.
That's what you
So-
still use now.
Yeah, so I use my 10 millimeter
No,
tip.
no, no, it's
which
working.
is
It's working. We just
more
haven't done
aggressive
it
than the 15
yet.
millimeter, but less aggressive than the XL.
Gotcha.
So it's like somewhere in the middle. So it'll tell you, it literally tells you everything. That's what's great about these little charts is that it'll say like, okay, you start from 40 to 60, always 15 milliseconds. You can do 3 to 6 passes. and notice how your XF is only 1 to 2.
Yeah.
Number of treatments are 2 to 5, 2 to 5. The treatment intervals is 4 to 6 weeks, 4 to 6 weeks.
Okay.
Very easy. So like if you literally read these little captions, you'll figure it out. So these are appy scars and surgical scars. Again, you're only going to look at these 2 columns. They're
So
very much
somewhat
the
similar,
same.
yeah.
This is the easiest hand piece to use. You're going to use basically the same settings over and over again.
So for today, we'll go here.
Right, exactly, because we're gonna do skin resurfacing. So we're using XF now. We're always gonna do 15. I don't even know why they put the 10 in there. And you're gonna start from 30 to 50. If you already did a 40 treatment on her, you can do 40 again, or
Okay.
you can do 45.
Okay. And I know you were saying with the training, this is your
Yeah,
guys'
this
thing,
is
but-
like, I mean, I'm not working for Cynosure right now, so
Okay.
I can talk a lot
Okay, cool.
more than I
So you're
usually
on
do.
next time we had to be like,
According to the-
yes. So you do kind of go, once you're feeling comfortable and you know the person's
Yeah.
skin and blah blah blah.
What
then-
I usually do is, so I know I'm always doing it. I only book these in packages.
Mhm.
So I do the first treatment at the lowest, unless I know they're a seasoned laser person. So if I know my client's been to every plastic surgeon on the planet, I can start them at like a 40,
Right.
as opposed to starting at 30. But I always give room for a bump up. I
Mhm.
like to increase almost every treatment a little bit. So I'm giving them a little bit more of an aggressive treatment. So, everyone's skin's different. So I usually start at the lower end. 30 is low. If you already started at 40, it's fine.
Mm-hmm.
You can do 42 or 44 this time. But it's just so that you can get used
And the
to what people
And
milliseconds,
how
you would
high
never
would you
go.
ever go?
Right for the milliseconds? Or the-
So my machine, I can go a little
Milliseconds.
higher. So I can go up to 70, and I go at 70.
Oh, okay.
But because I have the 10 millimeter tip. Your tip is a little stronger.
Okay.
So you don't need to go up that high. But if we're comparing, like you can do 50, absolutely. But they'll have more downtime.
And the milliseconds never change.
Never. Always 15.
Always.
Yep.
Where do you log your parameters?
My treatments, I'm old school paper charting, so I just write it down.
And then you bring it to the appointment. I mean, you go back and look at the.
I have my own practice, so I have my own office, so my charts are all in the cabinet, so I just pull the chart and I,
Bring it in.
Are you looking at the charts before you see a patient? I never see you next to the
Always.
computer.
On the computer, they do.
Yeah, I do it like either in the morning, always.
Right.
That's why I'm
Or
always-
sometimes
Somebody
you just
come at 2
know.
o'clock. I see you running from the kitchen to the other, going to
Well,
the
it
room and
depends
start
on-
shooting.
got-
Yeah, but it depends
Well,
on
if it's
what
like
it is.
laser hair
Yeah.
removal, like,
I mean,
we know
if
setting.
it's a
Huh?
facial microderm
Yeah, if it's
peel,
like
a
laser
lot of
hair
things-
removal,
yeah.
you don't have to
yeah,
do
that's
that.
settings.
Yeah, sometimes I just will put the client back or patient back, and then maybe I'm like, oh, maybe I'll miss what I did the last time, or
yeah.
but not.
I always look, I always look, I write everything down on one of
When
those.
Marina goes into her other patient, that's when she checks the computer real quick for the one
Can
that's
you
in
hold
the
the
other
IPA for
room.
me? I
Yeah.
have to go and check.
Do you mind just stepping in here and all
Yes,
that? Okay.
So that's it.
Are we good with this? It's still not working? Those
No, the 1540 handpiece is working, but the IPLs
still
are
not.
not. We'll
Why-
try again, but they're not,
Okay.
as of now.
It should work.
And for
Unless,
the IPL, for the hair removal, are you doing the same thing, like a? 10%?
don't lose these guys.
No, that's what she's taking.
Okay.
Okay, you can-
All right, who's going when you
Let's go. So you tell me pressure and then.
Yeah,
okay.
so, just everyone be careful. Don't put the laser up, it's almost like we're at the range with a gun.
Yeah.
Nobody point the gun at anyone. Keep the gun down.
Keep it down.
Keep it down. You could copy them and just cross out those rows.
Yeah.
Or just make your own little chart, however you want to do it.
Be careful because the laser, she said you really need.
Okay, so you want to put your settings. So 15 always.
And then this one's going to be what, 40?
So yeah, we treated her at 40 last time, so we can go ahead right back or just increase her set. She said her, I'm sorry, your treatment, you only had like a few days of downtime.
24
day.
hours.
One day.
Real quick.
So I would just.
Because I still need filler,
You don't, and then in order to take it off standby.
How many compliments were you getting that
This
day?
and you're ready to fire.
All right.
I hate it. Just so you know, I'm writing a pin. I'm writing a Dana. I hate Dana. So what do you
So
want to
I
Dr.
start,
Fox
most
agreed with
part,
her. And I was like, I hate you.
I try to look outside and I will start like vertical, so I start from the corner. So the most sensitive part of the face is the forehead and then the So if you start in the center, they're gonna like freak out. So I would just start on the hairline and I just kind of, I know the one.
I mean, I need it too. It's not like whatever.
Yeah, I don't know where anything going on with that, but I would just start.
And then, around the cheek.
Yeah, I leave them out for the lash just in case they have any history of hepatic lesions, you know. So then I do their forehead and then I do their mouth lines.
So this side, then the forehead.
That's my technique. You
All right,
can do
that's good.
whatever makes you comfortable.
Okay. But you guys goggle up.
I can't believe
So
that he told us
also,
we didn't
just so you don't,
I know.
yeah, put that there.
I don't know, that guy,
He did not know. I mean, I'm telling you, when I realized
called
when
and
we came
said-
out, and I was like, which piece do I use?
Yeah.
This back or forward or whatever you can do so you're comfy.
And,
Yeah,
You okay, baby?
Ready?
Finally. Here we go.
The numbing is still working.
So you want to
Yeah.
put a little pressure.
Did you tell Lisa to stop putting stuff?
Stop looking stuff? Oh, like I feel, no. We're hoping it might work.
How's it feel, man? Did you feel anything?
Yeah.
So if you put a little more pressure.
Okay.
And so it hurts a lot less.
Oh,
Okay, good.
Yeah.
maybe I should have tried that.
A lot less.
If you put a little bit of pressure, they feel it a lot more. If you put a little bit more, they'll.
And this is a 50% overlap?
She said 10, right?
10.
Yeah, I mean, I like, you can do whatever you want. The more aggressive treatment is gonna be 50%.
How's that feel?
I did 50% on the other girl.
That's good.
Yeah.
Doesn't hurt.
She was bright red, perfect, no white, no.
Yeah, there you go. So you did a more So that's, when you can't see the circles,
Yeah, when you can't see anything there. Now, what about track marks afterwards? Do you see any?
what, like pixels and stuff?
Yeah, like
Look, I
the-
just bring it, so you can see it on our map.
Yeah, so that's post-inflammatory hyperpigmentation. So if she used, so
That's
A,
what-
you
like
went a
a
little
line.
high energy. How high were you?
It's a 1540.
Feel
15,
okay?
40, but
Yeah, it's
15 and 40?
Yeah.
15, 40. That's why we
Pretty
said,
close there.
yeah.
Everything
It might be,
depends.
it might be a little high for her. Did you post school?
We had.
Did I get?
No. Yeah, so that was your mistake.
So what will happen?
You have to take the initial heat out. Now, you don't want them to go home and ice all night, but you want that initial heat to come out of the skin. That's how you don't get that.
So how long will this last, do you think?
Or do we do face or
A few
natural?
months sometimes, yeah.
Or,
You should give everyone that has a tendency to pigment,
Maybe,
I'm gonna just do that.
I mean, I
I
don't care.
but it's very important to post for very important. Because the same settings on the neck are too aggressive.
So on the neck, what settings would you use?
I would just take it down like
30,
5,
20?
10, yeah, 5, 10 points. Or on this, you
Oh,
only
she
do
didn't do it?
increments of
10.
6.
Oh, 6.
Right?
On
Oh, is
the-
it?
No, 2s, it's 2. 2, 4, 6,
You're right.
8.
Yeah. It hurts a little more in that area.
Well, whatever she would like to know, it's good, but I just wanna know the name. So I have someone coming in for an IPL tomorrow. I have someone coming in for an IPL tomorrow.
Let's see why it didn't connect with us.
So I get this side. Did we go far enough here?
No, I
No,
think I come
you'll
back.
have to, yeah, so you'll move this and
Okay,
then
move
it's
the
all
skin
has to
down.
down.
Yeah.
yours are super dark.
Like I can't see.
Yeah, well, that's the wrong glasses, that's fine.
So you might as well just take them off.
Good? Or do you see anything else?
No, I just, you just need to push this down and then go over the overlap. You know, like push that out.
Yeah.
Yeah.
Whatever you want to do.
Did you want it Ashley or do you want me to? No, it's all here. Okay.
Yeah, make sure you-
definitely do take a look.
The more you press, the less it hurts.
Yeah,
You're noticing that
Big
maybe?
difference,
yeah,
yes.
it's a huge
The
difference.
difference between laser hair.
The
This
overlap
doesn't
might not
hurt
be
at all,
bad
though.
enough, yeah.
Okay.
So we did like some ventilators before. She has this like mild.
Alright, so as far as charge, you did have a meeting, did you? That's what I was thinking. It's still a little peak out, not at all.
And you know you can keep your foot down and it'll
Okay.
keep firing, right? Yeah, you gotta get used to that. Don't practice.
I think with this, I think it's fine.
But if they show me, maybe she starts. But if we did a little bit,
The more sensitive there, yeah. I know, that's under part. Yeah, 750 with the green. That's fine. A little pressure. But take your foot off.
Yeah.
So if you're not getting it with the foot on, then just take your foot off and make sure you put nice and fit.
No, she said.
And this is 1540, just to go over, showing this texture. So what would be the, why would you, so the XD is just going deeper and is more texture. Is it more texture?
No, this is more scarring.
Scarring, and this is more texture.
Scarring deep wrinkles. This is more pores.
I'm a little bit afraid you're getting no, oh, no, I'm not. I'm not gonna be here for a little while. I'm gonna leave.
Oh,
I have someone coming in.
Is there anything like with this, you can't go over like holes or anything, or?
Yeah, I mean, this is a germ practice, right? Your patients are checked before.
Yeah.
You guys. Me is a different story. I'm not in the medical office, and they'll blame me, God knows,
Right,
or something.
Would you say this would help with like, any type of like milia too?
Not so much,
Yeah.
but Amelia, I would,
More like cable eater, like,
yeah.
And this is.
I like to go fast.
I guess you would.
Yeah, you can
I like
keep
to
it
make
down.
Yeah, I do,
and
and I
you
just
just
make it
go
go
faster.
We're gonna do that.
We're gonna go back right now.
What about hair? Does this affect hair at all?
No, but if you got dermaplaning,
Yeah.
they'll get a better treatment if you dermaplane them first and then do it. Because
Did
if
you ever play
someone,
today?
I was like, I'm gonna spray over her eyebrow and try to like lift this or no?
it's really, you can do that for
Okay.
anything outside of orbital wrist. So if you're on bone, you're good.
Yeah.
She's protected, you're on bone.
You can fly, good. She just had YAG. I don't even think these are good.
You have mine or it's over here thing?
No, yeah.
I mean, even like if you wear eyeglasses is better, just because you have a balance.
Something.
Yeah,
And then also contacts in, so
yeah.
sometimes that's like a nice little extra.
Starting out though, like for someone like me, they're talking about building on and being creative. I mean, so if you were someone when you're starting,
Yeah, yeah.
keep it simple. Like,
Keep it simple, stay to the settings.
that's certainly has,
You'll learn.
yeah.
This only, the only way you learn is doing it with this,
Totally.
with laser.
Especially IPL, I feel like.
Yeah, yeah. I mean, these
machines a little bit different too.
you have to get used to the machine, even if you're experienced. Anytime you get a new technology, you have to learn the technology.
And I feel like with IPL, there's like such a fine line, like you said, of like giving like a quality treatment and like burning your skin.
Right.
That's where I would say, like someone beginner, I wanna say, simple, safe.
Like, that's
and
why I love this,
quality.
let me show you.
That, like you guys are talking about building on, which is gonna be great. I don't think I should.
But it's actually like really no person to get
These-
right and know.
These settings are pretty spot on, so I love this manual, this is like one of the best manuals that I've seen. And that's because the
Doing all right,
clinical
Mandy?
team,
I'm
the
doing good,
nurses
thanks.
actually wrote this, that have done the procedure before, which is unlike most manuals. Most manuals are written by some tech person, and you're like, how does this apply? But the nurses really, the Palomar team,
Feel that
before
one?
they got bought out by Cynosure, they were like really amazing nurses. And if you read, so it breaks up into two things, vascular and sacral, right? And then they do according to skin type. So they'll actually tell you, they'll say, okay, so you want to treat
Right
red
here
facial
between the
vessels.
brow,
They're greater than.
a little tightening there.
So for finer vessels, you're going to require shorter fluid duration.
Good.
Higher fluid and shorter fluid durations are at greater risk of
Okay, you're right there, okay?
So we used to treat to make a vessel perfect. No, you don't ever want to do that because it's now time to treat. So now we treat to make a vessel. So if you kind of read this stuff, you'll get it. It's like, okay, oh, so what do I need to do? I want to treat a red chest and neck vessel here. So I'm
Do the
not
nose here or no? No,
sure.
we have to do the nose here and then.
So if someone's a
So
little
she-
bit darker, has a little bit of
She's
brown,
at this
I definitely
side,
don't want to do
this
20
cheek.
because that's a little short. So I'll do 30.
All right, well, I'll do this
So
side
it's
of the
shorter
nose,
pulses
and then you
over
can touch
finer
up.
vessels.
All right.
You know, so like, they'll tell you, so for pigment, face, darker,
All right.
denser face
Yeah.
may require a lighter pigment. So you have three
Yeah,
options.
you did not do the like
The first time, I would start with 10, those are the
You're
first.
trying real hard.
So, you know, they'll start with your 20, and then you'll see, you know, they'll come back to their second
One
treatment
here.
and say, you know what, I did really good with that. Now let's try this.
Doing good.
Whichever way.
Or,
No, no,
I
you're
did,
doing
I start
excellent.
out with 20 and let's say 40.
All right, you finish up.
But now you have to think, like, you know, so you have to just, that's why it's so important to know your previous settings and what happened. And if you notice, you see here, chest, neck, legs, hands, arms, and body.
Maybe you want to
It's
make your
between
tongue
30 and 20.
Now,
I would always start with 30.
so how
And you really felt it?
the legs?
Yeah, it looks like it. All right.
Very well, but it's hard with the match cheek, she's so tiny. So I use the yellow part.
And so I have a treatment, I think, on this lately.
You did this side of the nose. Did you do it up to here?
I actually didn't go
For hair?
on too
No,
much.
For pigment. So you generally
So
do
you can hit right
74? No, 75. It works for pigment?
It does, and I did a test bottom,
There
this
should be
one is
pigment.
right, grease
For filler, though.
It's painful, it's
Yeah.
expensive,
Better?
and I said to her, I don't know if it's even gonna work.
Because with your spot size, like,
Outside the So, I mean, I just went over like, you know, each spot, she has a ton of them, and.
Yeah, don't.
I'm not sure.
Why?
Should
Why?
I do the Y? And you think I'll get a good result?
Yeah, but I'm gonna tell you why, it's a little,
Let me just finish the
not
nails.
as strong.
Okay, so you can be a little bit more aggressive on the legs.
Yeah.
I don't like the job.
Um,
I mean, like it works, but I mean,
Good. Oh my God, let's say doing 1 and 2.
She's about 1 or 2.
Okay, so
Pretty
check.
bad.
Okay,
I
so
don't, like, I don't
if she
ever.
has a lot of pigment, she might type up.
I would say
start
that,
her-
Right in here.
I would say,
Yeah,
she's
so
so
then
pale.
she's pale.
Yeah.
And then
So I
stop
would start her at
treatment.
15 and maybe like a 30 or 32. Do a few zaps and then like step away for a moment. See what's working. Like that for a second.
Yeah.
And then you'll see, you see a change in shape, then you're good. If you don't see anything, I would go off. You'll
So
start with
Tina
that.
tried to make her just like tuck in her
That's
bottom
what
lip.
I meant. Yeah, how about with your tongue?
Or even put your tongue over your
That's what I
teeth
said,
and try to
tongue
make
over
this
your
area
teeth.
flat there, yeah, and you might even have to pull her skin like
Appropriate.
this.
Yeah,
so I'm
See
thinking,
that dead
yeah.
when you're
You don't
thinking it, there's a,
I don't want her to
There's
be
a
like,
hole.
so you might have to like.
Okay,
You
no
gotta
problem.
do what you gotta do
I
to
would put
make
your,
it flat.
try your tongue in there for a barrier. Who
on
put
their
the
body
cotton?
cheek.
Somebody put cotton in.
Yeah, I thought it was.
and
Oh,
then,
okay. Was that you that did that?
No. Yeah, put your tongue on your body
But do you
cheek.
think,
Yep,
so,
just
for
like
this
that.
And then I pull down to make sure it's
for the whole
Yep.
body, they do have good,
Okay,
and
how's
it's good for instead of the next.
But it's helping. as
For
far
the
as
first
replacement of
1 or
filler.
2 treatments. After you start in a really good pigment, and then you can always switch.
And then, when you were talking about like the global treatment, where are you as far as the Max G? Like, you go towards 7 pigment lesions, you said?
If I'm doing a global treatment, my go-to like setting is just 20/40. I pretty much use that all the time. 20/40. 20/40.
Okay. Because there was this other paper in this book.
And how many goes?
That's on
And
fit
how
types
many-
1, 2, like
And how many passes do you do?
1.
Just one, okay, so then Claire was right. He told us that we could do that many.
That guy's
He did like, yeah, he said you could do 2 passes and then spot 3.
Why would you do, if you're doing an effective treatment, you need to do that.
Right.
You should
Do you guys,
see
should we do
change.
the neck?
You can, but lower it.
Lower this?
Yeah, lower the jewels. I would lower it
Like
to,
38?
yeah, 36.
They do 36 or
Something too.
15.
Where's that book? Oh, here. So this is like a paper in the book that I found that I did suggest to a couple people, and I feel like they got like a nice treat, but again, I guess it's like not. It doesn't work.
So you said Max G 1 to 3, 15 to 40 is average?
No, not,
I mean,
not
not
turning
20.
over to 15/40 on a Max G, we'll burn them.
No, for
20/40 average. It might be high, you gotta look. Don't do anything without looking and observing and asking. Do you feel burning? It should feel a little tingly.
That's
If
why I
I
always
leave the
ask, 'cause
spot,
I'm so nervous to do it that I'm always like, oh my god.
I will tell you that if you see no reaction and you have left, you took the handies off of their face and now
Burning, but it's
they're just
tolerable.
sitting there, and if they feel burning, you are burning them. They should not
Yeah, sure,
feel
it looks
burning.
good.
What about
Tolerable,
like
but it's
tingle
not-
and
Okay.
feel?
So a tingle should be fine,
But like,
tingling, a light tingle is warm, but if you're off the spot and they're feeling,
like it's
like,
like really hot.
it's still
and
very hot, like, ooh, I still feel that,
Okay.
lower your settings. Yeah.
So like,
And there's just
Okay, you
one
wanna do that
pass.
half pass?
One
That's what
pass.
you say,
Sure.
settings,
Where you
15,
at?
40,
I just get to the bottom of the neck. So here you can see where it's red.
Yeah, I mean, like,
Not much
okay.
needs to be
We'll
like
say
this
20, 40,
spot.
see, those are my go-to ones.
Yeah.
Under here.
But 20, 40 could be aggressive on some people.
right.
Honey, we can
Our treatment doesn't drop right, you say 20, 40, right, so that's what I'll do, like, I'll use a 20, 40, go over the full face. If someone has a real crazy spot that I didn't really see anything, they hate that spot, I'll zap that one spot again, and then I'll leave it. Yeah.
So one pass spot treatment.
Skin type 4, one pass spot treatment, that's all. Full face, 30 days. Then we'll follow.
So light 4, I mean.
A light one, not a dark one.
Val?
She's too dark. She'll have TIA.
No, Val.
You told me that.
Yeah, he said you could do it.
Yeah, I guess that was what it was.
You said all, did you say all? You didn't have to worry.
No, that's the 15/40.
Yeah.
But the, so after one treatment with the 15/40, what do patients normally see? Or do they not see anything? It's really serious, like the Pico, like I feel like I say the same thing with the Pico. It's like, you know, you have to wait.
You're not gonna really see much unless you're really young. And then like you would probably be like, oh, well, my skin kind of looks good.
Did she just say that out loud? Okay, can we, is that on
That
camera?
everyone-
Is that on camera? 'Cause
No,
I'm like,
or you have, I mean, I don't know how old you are, or you have really
I'm
nice
old.
skin.
See, imagine if you had that
Oh.
filler, right?
just imagine.
Like 28.
Watch it.
Um, so I would, your skin's good, so if you're old,
Then you're in
then,
good shape, then.
so you look good.
Well, I don't know about that.
Doing good, almost through.
So, but you're taking care of your skin, so you have
I
skin
have
that
Dana,
looks like,
Val, Gina. We like to
yeah,
practice.
so you have skin that looks like 34, not 44.
Well, I'll be
have
44.
people 30 that have worse skin than you do.
Yeah, there are,
There's some worshipers, they have
Yeah.
terrible skin.
Okay.
Um,
We don't do anything here on top of the
As
eyebrow.
far as,
Here.
she said we could go right on top of her eyebrow.
Yeah, just be careful of
I went in
anyone that's,
between and right to it.
yeah, anyone that has tattoos, be careful.
Yeah, I don't go over it.
What's that, I'm so sorry?
Tattoo.
Oh, yeah, no, we didn't.
Eyebrow
I always
tattoo.
ask if they have
So,
eyebrow
but-
or lip.
So they just,
Yeah.
so after you do like a series, let's say we did a series of 4, right?
Hi, John,
weeks,
Andy.
Good.
after that,
Yeah.
what should we see?
Take off your goggles.
What would be just like tighter pores, similar to the people in that kind of way, where they're
Tighter pores, their skin will look, the quality of the skin will look better. Their fine lines will be decreased, not gone.
yeah,
You know, the fine lines will be better. They'll get compliments on the skin. People will be like, what are you doing? You look good.
It's
You know,
just
that
click
kind
in,
of
I'm
thing.
like afraid of
Yeah, so like
foresight.
Their skin looks
Yeah,
tighter.
do you know?
Okay.
It just clicks in.
Alright, and usually you could do a series, depending on the age, a good series of 4 to 6
Average 4 to 6. Rather than buy and commit to more than,
So like I did my Phil and motivation on this.
Good, of course.
I see her, yes,
Her
that's
chest
nice.
looks good, right? But do you think like it's like it was bad? It was just like a good, so a little bit more.
That looks
You
good.
know, this is good. And then her face, you know, like I'm nervous on her face. Her face, I did like a 30, 36, I think, 30 MS, 36 joules. Her chest, I did with the Y, 20 MS, 20 joules. I did the skin tone, but
No, but the chest looks good.
but her face could be better, right? And you think, like, what you think I could have been okay with
I can
that?
see her pigment on her face
Right.
right now. Maybe on the side.
Yeah. She's had a couple of them like that. These guys over here.
That's good. That's good.
So something that we
But
said.
this is like a typical reaction, or would you sometimes want to see more than that?
No, that's a
Just
good
sitting here,
answer.
just good like that.
You don't want them to be blistering and
Right.
fire.
So sometimes, you know, it's called, like on her chest.
Yeah, and that on her, so she's a little darker, so she might see even more today.
Right. Yeah.
Can we try to switch the?
Yes, we can.
So for my
Wanna
next
try and
one,
switch?
she has a little bit of acne scars. Should we do with the setting
What, this whole thing off?
Should we do like maybe
Thanks for being
extra-
patient, Mandy.
Do I need to turn it off before I
Yes,
switch?
yes.
How do I do? Turn it off?
System off on the right bottom corner. There you go, and now you can do it.
How'd my sister do? Hey! How'd you do?
Yep. Oh, we're switching out to the match sheet.
Burns a little bit.
You've been there a long time.
Hey Lisa, do you want to get the
Trying to get things to work.
fun
the
for me.
2940, the ablative one? It's like the Pixel.
No, not like the Pixel.
Not the CO2. It's lighter.
Yeah, but the one that leaves you all bleeding and all?
It won't be bleeding. It'll just be like a little bit crusty. You can say no. I'm just wondering.
I'm just, that after the Pixel experience, I'm terrified. I don't want to look like the Pixel. Is it
Okay.
going to
gonna
be
be-
painful?
Yeah,
Yeah, no. I mean, the recovery after, I mean, during it, I'm fine. It's the recovery
the
after.
recovery
What's-
is it's annoying.
Yes, you know, I'm not,
Yeah,
can't, won't,
it's like that bronzing. It's
Yeah.
not easy to cover.
no.
Okay.
It took me a weekend and it was awful. And then my chest got infected, remember? I can't do that again. I'll do whatever else, but that one I
Yeah,
can't
that's
do.
more like preparatory work.
Yeah, yeah.
You really need to prep the patients. You need to prep their skin.
Right. Well, I know. That's why I
You
just
need
asked
to,
Lisa
like,
because
yeah.
she's
Because
like.
normally I'm like the game for
Yeah, yeah.
anything, but that Pixel did me in. I did it, no. I did it once to my face and literally, I looked like, I went to the grocery store the next day and you couldn't stop putting Aquaphor
Yeah.
because it hurt so bad.
Just suck the right.
But I mean, it's amazing how quickly for the first 24 hours
It's
was
the worst, I know.
And I gotta work in front and I gotta work tomorrow. And then we did my chest and my chest got infected because I went to put a stick to someone. You can do whatever you want else, but not that. Unless you do it
What's
in
that
an area
mean?
that won't hurt.
Oh, it's because you. Oh, so this
You're
needs
red.
to be in here.
I'm red.
Not there.
Yeah.
So this
So
goes.
burn.
Yeah, it burns quite a bit.
Yeah, keep the ice
It's
on
the
there.
magnet sensor.
You got such good results last time.
I did,
Did you do the same thing on there?
Oh, he does. So lucky. Here we go.
Let's go. Move somebody.
Hurry up, Dr. Your patient.
Oh my gosh, Mark.
Too
So
small.
are we
We had
doing
the
both?
magic touch.
Yeah.
Alright, so can we do the max sheet and the 15?
Yeah, move it.
Already?
I was like, I'm scared. This is gonna work.
All right, then come get, I'm in my office, so come get me when you're ready.
All right, probably
When
later.
you're ready, I'm over there.
You want me to bring the phone here? You have to work for your money.
I work for my money.
So, with your skin tone, you were saying.
I work at home too.
I think it's charged.
But they call me all the
You
time.
don't want to go over lesions. No, sometimes I do because I get nervous that it doesn't read like, but it can, I guess.
No, you want to go over your normal skin,
It
so
comes
it's
in
properly,
yeah. You want, I'm just down to the left.
analyze your skin to type you
will.
properly.
Right.
So if you're doing someone's, let's say you're doing a woman's chest, right, and she's got a lot of sun damage. In that case, you don't want to put the thing directly on top of one of her darker lesions on her
Right.
skin, but you want to get a good reading of her entire chest. So you want to get a good reading of her entire chest. So you do want to take that pigment into account because it will type her
Right, because
higher
Right.
because of the artery. But if you're treating like you have a few sunspots or nothing crazy, you want to. I usually do it in zones. Like you want to do like 3 readings in 3 different zones.
Right.
If you're doing a global treatment, I would do 1 here, 1 here, 1 here. It gives you the average of the 3.
How are you? I like always just do all the time because I'm nervous that like I didn't get
Well, you
enough.
can do more. You
Right.
can do 1, 2, 3, 4, 5, 6.
Okay.
Hi, good, how are you?
She know?
Yes.
Oh, so we
You
can
put
put right.
the,
Yeah, that's okay.
Which one are we now?
Just
Oh,
tell me,
okay.
because the Max Tree were.
So the Max Tree's working?
Oh, right, yeah.
How did you
Just put it in.
You know what?
So he needs to come every time you need.
Tomorrow I have one, so you better be on call.
Or like, yeah, paper and general license.
Oh, is it, you got it?
There's still someone.
women.
Is that on the film?
She has
No, it's not.
No, it's in reality. It's everywhere.
blush sensation, I would say.
Yeah.
Every time I
So
do like something on the computer,
She could accommodate a 15, especially if she has.
Me and her with TV. I call, all the time, I can't get the volume.
But, do you want to use the skin tone or you want to go according to?
Well, let's do the skin tone and see what it says. Compared to what we would do. But we need to clean this up.
The video's only for our training purposes.
It's okay.
Making your mama like it.
How do you know I have an
I know, I was actually gonna say.
Also, for the skin tone, you need Lux Lotion as well.
Yeah,
Is that?
because the first time I did it, I was like, oh, it seems wrong, and then I was like, I need the Lux. Remember we were doing
Yeah.
it to your arm, and I was like, remember, we were like, should we do it without, was it? It wasn't that much different of the settings, you know.
Oh, without
It
the
was,
Lux.
but still, I mean,
Yeah.
Sorry, I know it smells. Right. Yeah, you're.
So we just did it.
Put the Lux Lotion, dab it all over her entire face. I'll go more.
yeah, I really, really long.
You want to see the whole skin.
Shiny, you wanna like see it shiny.
Okay. So when you look at the settings for skin tone versus the settings of her.
Like, oh, I know.
Did we take them out?
Yeah.
Pretty good.
I knew I took them.
So the skin tell settings are different than.
It's just a different, you'll see.
Okay.
When we do it. But it's nice to compare.
It's for the next generation. Okay? For the for this excellent esthetician that is going to replace you.
You better watch it.
How are you gonna
Careful
replace
what you wish for.
I think so. I'm the first one to go,
And then the second part is.
because I'm the old lady.
You're the first one to go, right?
Skin
my
You
hand.
You don't have to press it. What it does is, as soon as you contact the skin, it just does it. So here was one measurement, it's 15. And then I would do another region, 17, 16, 19, let's do one more. 15.
So we just say around like average 15.
So we have kind of enough readings. It's going to give us the average. So you have to hit the button to transmit.
They told me I should go back to medical school because, yeah, it's not good, yeah. It's just like,
Okay.
Linda, some crazy patient.
So I just want to show you how it works with the skin tell. So whenever you're doing the skin tell, whether you're doing your own settings, the first question, am I doing it for pigment? Am I doing it for redness? Am I doing it for vessels? What am I looking for? So what are you looking for? What do you see in her skin that you would like to get rid of?
I think right now it's more the redness, right, Christina? The browns is like mild, but
Everything she mentioned.
and then we'll get different texture later.
So-
on, but I think the redness and the sun.
So right now she has redness. So we're going to say we're looking at vascular, right? So now we're going to take our vascular chart. And this whole process is going to be the same no matter what we're doing, whether you're using this skin towel or we're using that, because you're going to see the process. So when we use the skin towel, we know that we're looking for redness, but it gives us a lot of different ideas for redness. So we have alar vessels, facial vessels, but she doesn't have that. She doesn't really have vessels. She has a flushing overall redness to her skin. So for flushing rosacea, for her melanin index, which is a very large melanin index, it's from 1 to 24. What we know is our pulse width is going to be 10. Okay? So we want to adjust our pulse width to 10 on the computer, on the screen. So when we go to 10, what the machine does itself is it says, according to her melanin index of 16, her joules for this 10 millisecond pulse width is going to be a range between 28 and 34. So you're always going to start at the lower range of 28 and 34. So what you would do is say load fluence, that little arrow. There. So you're set up for your treatment, right? So this is how you use the skin tell. But we're going to be skeptical. We want to say, you know what? The skin tell didn't work before. Let's look at the chart and see how we would treat her. So go ahead. So now we're doing the same thing. We're saying we're treating flushing rosacea, flushing redness. Go
And
ahead.
this is for our skin type 1 to 2
Right, which
at 10 ms.
which we could establish, right?
Yeah. So that's a 30 to 42 joules.
Right. So look, now I just want you to just think outside the box, right? Let's assume we don't know to do 10 milliseconds. Let's look at what the options are according to the chart. So we have two options, a 10 millisecond and a 15 millisecond. Let's read the little writing on the side.
Right here.
Yes.
If there is just flushing without distinct vessels, consider treating with the shortest pulse duration. There is an increased risk of purpura at high settings with shorter pulse durations.
So we don't really see many vessels. So what we know is that no matter which one we did, we kind of came to the same conclusion, right? So we know that we don't really see any vessels. We can treat her at a shorter pulse duration, but we definitely want to treat her at a low joules, because once we go short pulse duration, we don't want to increase our joules. That's a very aggressive treatment. We want to err on the side of caution. What's the lowest joules there?
30.
So it gave us 30 on the chart, but we actually got a more accurate reading of her melanocyte activity through the skin tell, because she has a little bit of pigment hanging around. So our joules are even lower, 28. You see how the skin tell is more useful? It's safer. It says, you know what? We took a lot of readings. We saw a lot of variation. We saw some darker numbers. Here she was a 19. Up here she was a 17 or 18. On her cheek she was lower. So it gave us a lower joules to make for a safer treatment. So that's why your skin tell can really help you. And you'll see the opposite when you're treating darker people. Because now it's going to say, oh, you know what? You could go a little higher. Or not. All right, Keith, let's go back at it. So I would do that. I would treat her at 10 milliseconds, 28 joules, keep it there, and see what happens, and look at her skin and observe her response. Whenever you do a shorter milliseconds, the one thing you're going to see is more redness. That's going to pop out at you.
Yeah, that gets scary.
Yeah.
Yeah.
So you'll see that little weltier experience.
Yes,
You might
yes.
see the
Like the
swelling.
swelling, yes.
It's epidermal swelling
Yes.
because you're punching it in really, really fast.
Yeah.
So it's
when you
important
see
for-
that,
it's okay. You don't want them to be throbbing.
What
You
would
want to
happen if-
ask them. Yeah.
I'm sorry. What would happen if we went with the 15 millisecond? It just wouldn't
it's fine.
be as effective.
You might not get her redness as much because it's just a flush. You could always treat safer.
Right.
20?
But 10,
Always.
28 is safe.
It's safe unless and you're not gonna like ignore her and zap her whole face.
Right. If she's saying
If she's saying, "Oh wow, I don't know," you're gonna do a line of zaps, 1, 2, 3, 4, 5. I always do that. I don't care how confident I am. I never fire and do a whole face treatment without stopping for a moment, looking back and saying, "How you doing? How you feeling?"
Is there anything that, say she feels fine, is there an endpoint that you're seeing that would signal to you?
I see a doctor.
Oh, an instant.
If I see something,
swelling
the swelling is
red.
okay.
Was it?
Yeah, squeezy ball.
Oh, thanks.
But I'll always ask her because they're gonna know more
I
than
don't
you.
know, I think that, I don't know.
The other thing that's true with that though, it's just like,
Some
it's
people,
all
some
relative, you know?
people like,
Yeah.
you know.
I feel like this one, the swelling, like
But,
I've been
alright.
seeing more swelling on this one, I feel that I've used in the past, and it's kind of like,
Because this is a strong.
yeah. So it kind of creeps me
So-
out.
If you're nervous, whenever you're in doubt, increase your milliseconds. That's it. Just increase it. If you're seeing things that you're not confident with, now I wouldn't start with her forehead. That's the other thing. Never start a treatment on the forehead for a few reasons. A, more sensitive. So if they were fine here and you went here, most likely they're going to be more sensitive
Yeah.
here. So never start on the forehead. Second thing is, most people have more sun damage on their forehead than anywhere else on their face. So this might, like you said, you guys were very good. Do you decrease on the forehead? 9 out of 10 times you probably will. Sometimes you might not. But, so never start on the
Also,
forehead.
it's the wrong setting, and you're gonna have like one big.
Exactly. I usually started
I like to start here, on the side,
I usually
exactly.
go right here.
Yeah, I usually start like right around here and then go down.
Start like right here.
So, everyone has IPL glasses, you have your own glasses.
No, they're both wrong.
They're gonna throw?
IPL glasses are
These are
tinted.
dark.
Yeah.
These are really dark, if somebody wants to see.
They have an idea.
Oh, we got another one?
I don't even know if these are right or wrong. I'm just gonna
Yeah,
show that.
I have some. I'm
What's
fine.
behind you too? Is there
I feel like
Take
you need to
yourself.
start, I'm
Yeah,
hearing the
go.
machine, like, moving.
We have to come up standby.
No, they're good.
Come up standby.
I know.
And I need the gel on for this one.
Yeah, gel's on. Turn her head, start in the corner, do a few little zaps,
You got-
and then
you got
take
gel.
a look.
Fine, don't be hasty.
Yep.
Okay.
Good, nice pressure.
So you think this is good or am I going to?
No, this is nice pressure, good.
We're back off and.
How do you feel?
Me, fine.
Does it hurt? Do you
No.
feel any burning? Oh, she's numbing.
Yeah.
That's the other thing why I hate numbing for my
So
kids.
I like to have them feel it.
Yeah, I can feel it a tiny bit.
Okay.
Just probably because where it's at the middle.
And also for numbing with IPL is that you don't see the skin response as well, because we're taking away that circulation, but she's fine. Don't go off the face with your settings because the neck is more sensitive. So let's do her whole face first without going off the face. And then if you want to get some of her marks on her neck, you can always do that after the fact. That's kind of her neck, but we're all in a different. And your overlap should be not tight enough. So you stop there. So look, don't put your foot on the pedal. Just everyone look for a second. So you see how there's a gap in between the actual crystal tip and there's a lip to where the handpiece ends. Your overlap has to be super tight, otherwise you will see those spots of misspace. So that's why the 10% overlap is so important.
I don't know.
Yeah.
I wish I felt like that. Monster did it to me.
Alright, we're getting somewhere. Come off the skin of my hair. See, good. So let's look at her now that. So you see how she's a little red? You can see where she's treated. She's a little swollen a little bit. This is good.
Now, without the numbing cream, do you think she would be more?
A little more, she might be a little more red.
Yeah.
She would be more red,
She
right?
might, yeah.
Yeah.
Used to like using the laser there.
Do you have any issue
Like,
here
I don't
with
wanna lose my spot.
it's not normal, it turns off.
No.
No.
It's a purely a connection issue on the handpiece itself. So,
So before it didn't even start, right?
Yeah.
before when you start, because it's not,
Yeah, look.
no, you have to put that in there.
Oh.
Put it in the
That's funny
cradle.
that it needs
So
that.
basically there's a magnet, let me just show you. So there's a magnet in here, see right here? That communicates with the magnet in here. So you always have to put your handpiece in the cradle as it warms up.
Right.
Move it now.
You ready?
If it turns on, I'm moving.
And keep on going, I'm gonna put up the hurt. Go.
Go. And go.
Ready, set, go.
I have it, so you can keep going if you want. Right around the eye. This machine does seem pretty bright though also. I feel
It
like.
is
so bright. It's so bright.
When you're running now,
Yeah.
you know.
Yeah, they see the light.
Oh, I couldn't believe how bright
Yeah,
it is.
yeah.
Are you familiar with the Alma? The
No.
Harmony?
I know the Cuteras, I know the Icon, I know most of Cynossure's lasers.
We had the
And the
Alma
Luminous.
until now. And then we kind of upgraded to this. When you said that it's among the best IPLs,
IPL.
which one would you consider otherwise?
This IPL is, I would say, one of the best on the market. Cynosure actually makes, before they merged, so this is Palomar, before they merged Cynosures, it's called the Elite, the MPS. That's a pretty intense one as well.
Elite,
Yeah.
the latest one.
The latest, it's not, no, this is the
Elite,
newest.
no, Elite is.
So we're not even using the cooling machine.
Somebody actually just now stopped by, offered to sell me the Elite.
Want to buy this roller?
No, but you don't need it now.
I have another office.
Oh.
Afterwards?
What else do you, so the Elite has a lot of stuff on it. It has, you can get the laser, you can get 755 and 1064. You can get IPL,
Did the cheek imaging?
so you can do a lot with that laser. So find out which one it is.
What handpieces they have?
Yes,
In what version? How many generations did you have?
I think there's 3 or 4.
What are you doing?
There's a lot of different Elites.
You okay?
You didn't cancel your patients?
Okay. Now, because we're working on on like the redness, again, would I not use as much pressure like you were saying, or like?
No, it's just vessel.
Just
The
vessel.
redness, yes, you can use pressure.
That's my process.
How was my overlap?
Good. Make sure you pressure.
Firing.
Yeah, you can.
Do that.
No, if you're comfortable, it's just that what happens sometimes if you're too fast
The pressure doesn't
is
go.
that you might get a zap every now and again that you don't have that full pressure, and that's when you'll get, you know.
That makes me nervous.
No, not to be nervous. It's just to be aware, you know. Especially on the face, because the face has a lot of peaks and valleys. You know,
Right.
you want to make sure.
I'm gonna go over your nose, it's gonna get a little bright, okay?
Okay.
Now, do you have any suggestions, like special things for in here?
Yeah.
Little tips?
Without pressing, right? Like this. Yeah. Like that. Then I push them down like that. And then here, I'll do this and like that, just hang over. If I don't have enough room and the bridge is too narrow, then I'll use a gauze pad and just pad the other side. But if you were doing a vessel, yeah, that's okay. But if you were doing a vessel, let me show you the pressure. So when you're zapping vessels, you want, basically what you want to see is just the even of the light placement down, and that's it. So you almost want to just barely touch, just get it zap right away. That's how you put it on vessel. And you can do it.
Same settings?
You can, well, with those settings, a vessel might give a little purple with a 10. You might want to bump it up to 15. You
Should I-
try it. You'll see it right away. If it turns purple, you increase it closer.
How's that, that's too much?
But now you made too much time. So with a vessel, you have to act quick. You have to like literally put it down and zap it.
Alright, because you don't want to do it too.
Yeah, because then it'll cool it down. You're gonna compress
Alright, ready?
it.
Up that?
Up, up. Sorry.
What are you gonna do?
You need a little bit of a higher tool next time. I wouldn't do it again on this setting.
A little bit.
Okay, I'd like to see it a little better. If I had a mask, I might trace it, and then I can go over it by protecting the rest of the skin. But if you don't have a mask, I don't love chasing after them, because then they can get like a lot of hair. Plus she's numb, so we don't know what's truly numb.
Anybody else want to try?
But wait.
I didn't finish your nose, I just did.
No, we want to change your settings back.
There.
Do it 10,
Sure, you didn't use my cup.
I don't even know if you said this earlier.
Yeah.
I blink no matter what.
Yeah, it's just.
Yeah, so do I.
But
So where did you, let's see.
I don't think she did her forehead.
So no forehead and no nose, but the corners of the nose and no lip either.
What?
Did you come into town today, or did you get somewhere?
you drove, you didn't need to change.
Yeah.
like how to control
I think like
it.
your husband like Wisconsin if I don't put your face over.
It's like, it takes more time for me to get to Penn Station,
Right,
do all
right,
that, if I
yeah.
go leave from my house. It's
Yeah.
only a 2 hour, like 10-minute bus. But I left later because my son was like, I felt bad leaving him.
Yeah, is he the 5-year-old or the?
The 2-year-old.
Oh,
And he was like, Mommy,
really, yeah.
I need you, I need you.
So do you have a daughter and a son? No, I have 2 boys, that's what I said. 4 and 2. Yeah. Crazy.
I'm hoping I'm not.
You don't know your background.
No, it's early, of course, but I had my risk test on
So what
Monday.
else did you not do?
Bart hasn't left.
I did the list, I'm gonna do the forehead, but should I lower the jewel set? What do you think?
Yeah,
I'm sorry.
What do you think I should do for a forehead?
I would keep it and see what happens. Like, do 2 Zach, but she's fine.
Yeah, I
Pretty well
know.
here, even though she is.
And that is already a lower,
Yeah.
right?
Yeah.
How are you feeling? Fine.
We don't normally.
Not for
yeah.
IPL, but for the 1540, we didn't think that IPL was working, so we were just gonna do 1540 on her.
This is what it's about.
Yeah, but since it's working, then we're doing it anyway. so.
I can't believe that will work.
I know.
Well, I mean, it works, but.
And then I was like, trying to I was gonna get it. Kids like,
All over.
growing up all over. But not all over.
The worst is
like,
when you're not following me.
Oh, you
just
didn't
throw for
get
the
it.
first time, yeah.
But they don't know
he's
how.
like, and he starts crying. I felt so bad. I was like, I know, I'm sorry.
Did the 5-year-old have it and then the 2-year-old
No.
have it?
So this virus is, I don't know if it's going around out here, but like, it's like wildfire in
Yeah.
New
That's
York.
my
Yeah,
brother's
it's
whole
insane.
house just had it. He has 4.
Yeah.
Yeah,
Okay.
but my husband had it for Thanksgiving, and then my older
Now
one
let's
got it
go
very
down here. We should just
mild
over
version
here.
of the same thing.
And
And now all of a sudden, months later, the little one got it. I like wash my hands at a million times, like one night.
Do you guys wanna do a dance after we're done?
We should do
Tap
say
dance?
something
Yeah.
really mean
A
about
song?
her. Really mean.
Sorry. What's your daughter's name?
Hadley.
Oh,
Call her Hattie.
I love that.
Doing okay?
Do you hope for a girl? Or you have a boy? Oh, all right, yeah. So you will find out.
Girls are crazy, you don't like.
Whatever, they always,
They're
only the
all
only people that
crazy.
say that are what people would go.
Yeah.
You ever get that?
I'm on the beach with my daughters.
Oh, there you go.
Say, I don't believe it.
How old are your kids?
5 and 7.
Yeah, no, I don't believe it. Girls, no.
I mean,
Yeah, but just think they're very.
You know, kids are kids.
she's adorable, but she's sassy.
Yeah, I would say girls are more mentally draining, boys are more physically draining.
Yeah.
Boys like wake up and are like ready.
Ready to go.
No chill
And
in
they
the
don't
room.
stop. They
No,
don't
don't
stop.
Never.
No, they don't stop.
And they
I want to say it gets better as they get older.
They don't, right?
Doesn't, no.
How old are yours? Said
Almost
3, right?
17, 15, and 13.
I
Right.
can't even imagine.
So what do you think? Like we finished one cast, I don't
I
know.
feel like I
We
She's
should
good, but
go
she's
to
numb.
spring
I know,
spot.
right.
And we're gonna do, are we doing 1540 on her?
No, we were only gonna do that just because we
All
wanted
right,
to do
so
this.
then, yeah, you can go again. You can go over her round.
Should,
At
do you
least,
think
like, a
that we
couple
would
rounds
change
up.
the settings?
So lighter pigment, shorter pulse width anyway. That's,
Okay.
if you look at the pigment, now it's just to entertain ourselves.
Yeah,
Here's the,
Here we go.
look at the pigment chart.
So lighter skin, shorter pulse
face, darker
Lighter.
notes or pigment may require a longer coloration, lighter pigment may require shorter coloration.
Right.
So this
So that's
is
the face on the
three.
3. Let's look at a face on a 1 and 2.
So
So
10
look, it
and
has
that's-
zoom, so you can even increase your tools a drop. There you go. And I might not do a full global treatment,
Yeah,
just
just
do
do
like
the
one
spot.
spot, or wherever she has the pigment, even on her forehead a little bit. Yeah, that little patch there.
Yeah, this is good. I like the way this is.
Yeah, it kind of tells you, you know, it's like, oh, okay.
Usually we like laminate and hang from it, right?
Yeah, we can do that. Really definitely.
Or, oh, is that a door? Yeah.
Is that a door at the bottom?
You can put them on a ring and hang it from like here.
Yeah.
Anyone wants some joys of
Yeah, you have
pregnancy.
to just eat
You
all
eat
the
like
time.
every 5 minutes.
I eat all the
You get that right?
We just see after this if we can get that 2940 to work.
how'd you do? Good?
Yeah.
Yeah.
Not too bad, right?
I could slept right through that.
Oh, wow. Yeah, so I don't think I'm gonna
I
do
would
numbing.
ice her a
I'm
little
not-
bit.
Yeah, I'm not gonna do numbing for the IPL. I don't really normally ever do it, but I feel like I like it when you can kind of.
I like it,
Yeah,
you know.
Yeah, we'll do it. We're gonna do it.
I like them to be able to tell me what they're gonna do.
Yeah.
Yeah, that's what makes me nervous.
important, yeah.
The other one you don't really need to worry about, 'cause I don't wanna feel that. It's so awful. It's so awful.
And not to mention they don't get as red either.
Yeah.
So, it's 2 things there. I did.
It was like a breeze.
Yeah. I mean, it is nice to have, it should be hot.
Yeah.
Alright.
Yeah.
Cream on.
So,
Been a while since I had my hands on one of these.
what are the, in New York, you guys let, oh, you're in restriction.
Yeah, estheticians in New York, like, in New York.
Oh, really?
Put that right on. the
Estheticians
table.
can in New York or cannot?
They can.
They can.
What
New York
can they do?
and Pennsylvania, the mostly, yeah.
Yeah, which is crazy, because Pennsylvania is like, New Jersey, you can't do
In
anything.
New Jersey,
Anything.
no one can.
It's like, I mean, why would we even?
Hanging by a thread over here.
You really can't do anything in New Jersey.
Yeah. In Jersey, only like NPs.
Yeah.
Like even RNs can.
Yeah.
Yeah, they're really
crazy.
strict.
Or like
So what are we
Missouri.
doing now? What are we gonna do
She
now?
wants to put the octagon. Let me
I want to
just
see
look.
if this works.
What is it? Oh,
The 29.
Who are we gonna do that to?
I just want to see if this works. Remember, you couldn't even get a.
A tongue depressor?
We grow a bunch of NBC anymore.
Or an eggplant? Do you have an eggplant?
Everyone's, Claire said the same thing with the eggplant.
What's the name?
An eggplant, you can see the track marks when you do this.
What?
The practice, yeah.
Alright, let's.
Will you hold that for a second?
It's been, last time I trained on a
Yeah.
2940 was a year ago. I have to refresh my memory.
It's okay, we won't, we won't judge you.
Yeah, no worries. I'll.
No, I tell
Figure it
people all
out.
the time. If I don't, I'm not one of those like
I know
fake it
everything.
girls. Like
Yeah.
I'm like I don't know. It's not one of the machines I have every day.
I mean, I can see how you wouldn't use this all the time. I mean,
We don't even. I don't even own this handpiece. But you know, we have to know everything we train on.
Yeah.
But unfortunately, sometimes
so you have your own practice, but then you do this.
I work for Cynosure.
And how do you do that?
What do you mean?
I mean, so
So
Does
they
it
assign
conflict?
me,
Does it I mean, like, how,
Yeah.
how are you able to do
once a
that?
month I'll like go, so I train for Allergan and injectables, and I also train, you have to put it in.
Oh, right. I was like looking at that. I'm like, what's
Oh, it's also asking for the optic. So I train for a few different companies, let's leave this part on. There you go. There you go. So I just do it per diem whenever I can.
And they don't mind? Like, will they like offer you something, you're like, okay,
It's,
go ahead?
most of us are per diem, trainers. So they'll like assign us 1 a month.
How far do you have to travel?
I get all of New York. I was in Saratoga last weekend. I do a lot of Pennsylvania. At Philly like 3 times over the past 3 months.
Oh, wow. So how did, but you said today you're not working for Science for the group, just talk
No,
about-
because you guys bought this not through Sinashore. And he got my number from, I guess, another, I don't know, someone.
And you're allowed to do
Another
that?
practice.
Yeah, I mean, this is like independent work, you know? It's actually better.
Yeah, yeah, I'm
I
sure.
could do my own. I don't have to submit all my paperwork and, you know. And that kind of just.
Yeah, it really is like the, Pixel. I mean, it shouldn't be that difficult for us.
I know, I just wanna,
Oh, yeah.
I mean, I know we're not doing it on every day, but at least, cause
But
I
I
feel like the
can't-
IPO and stuff, we can figure that out a lot easier than this, you know?
I just can't remember the different. Let me have that manual.
Yeah.
Each of these are different things for, I don't remember.
I remember him saying what they are, and I. Where are you feeling? Thighs?
Wrinkle target, which is the one we have on now. This is for skin surfacing. The one I have on there is deeper.
Oh, Jesus. It's not looking good for us.
Blue is the fractional active moderate surfacing. Deeper surfacing. What's the golden?
I don't even see it on there.
Maybe this is a calibrator. What is this?
Oh,
Oh, yeah,
that might
it's
be the
calibrator.
calibration. Yeah.
That's what it is.
I knew
Oh.
something. I knew. It's
So
all
this is a
coming back.
calibrator. I'm like,
Yeah.
what is this?
It's all coming back to me when
Yeah.
Like, I don't even
Yeah,
see it in the
I'm
colors.
telling you, like, you have to work it out even. Yeah, so this is what for calibration. Do you guys know how to calibrate the other ones, by the way?
Not really.
I was just tell you, show you how to do that.
Like stick it in the thing or that thing on the side.
It's very easy. You
Yeah.
just stick that annoying piece that always hangs down.
Uh-huh.
Yeah.
Where?
The
In
great
here?
thing, no, on the actual handpiece itself. Where is it? I'll show you one minute. The great thing about this system is that you don't have to calibrate unless it tells you.
Oh.
So what it'll say is, it'll show you a picture. You saw how the picture, you know how when it told you to put the handle in the cradle,
Yeah, so
it was
up
like,
the
it
picture,
was
yeah,
like
yeah.
so when it does the calibration one, it actually shows you like a picture of the calibration tip and a picture of the handpiece, and it's going like this, like in an, like do that.
Yeah.
So literally, you
Yeah,
just
because that's
do
what it
that.
was saying for this
Yes.
one when he plugged it in, and then he was trying to calibrate it, and it
And
wasn't
then what
reading.
calibrating? Usually they're pretty easy to calibrate. You just press it and then it does it. I'm guessing that the reason why it wasn't working is all stemming
because
from
of
this
that
one
issue.
thing.
Yeah.
Did he fall?
Because there's like 3 of them.
You have 3 of them tomorrow.
Not just tomorrow, but like the rest of
Which
the
is
week.
nice, yeah. Let me take her ears. How's it feeling? You can't still feel anything?
No,
It's looking totally good. I'm gonna put this one up here, okay? Yeah, you probably have one more. Just in your chin. Yeah, all this under there. Yeah, you can.
my dad would be like, you guys good?
I was like, Dad, can you post like this? I was like, can you make sure you post it? I don't post it. The last time I came home, and there was
Not looking good for us.
chocolate
Not looking
covered
good
all
for
over
us?
my
No.
children and my couch. Oh man. So now Lisa's gonna. Oh, you know what's weird?
Huh.
Maybe that green light was just on the side there. I just when you pushed in, I saw like a green light come on.
Where?
Press in again. Maybe it was just because the system was started.
I'm sorry. I just wanna look at this.
What time does your husband get home? Here, we'll
5:45. But I'm gonna have to leave. Because I don't want to talk. Are you what time are you gonna talk?
I thought we were just like 5:30.
So this is the one that you use for the deep areas like perioral or just, is it also say deep wrinkles? Not inside, yeah, not inside boiling room. So you can use, so this is your deeper one and this is your, like the one that you can use, probably like your pixel is your blue. It's like for the full, like a full face global treatment.
That one or I think.
And basically the takeaway from this is that the more passes you're doing, the more surface area you're covering, obviously. So the way it fires is you could do your first pass like this, and it shows you basically how, the point of these 5 point, is that it's showing you how much percentage of the skin that you're getting to
It's
when
like when
you're
you do
doing.
the Pico, how do
Yeah.
you do that? Just slower.
So I would never like go crazy on this. I would, if anything, I would just do like one pass and then another second pass the other
And then see
direction,
how
and that's it.
Okay,
That's what I would do.
okay.
And on here, I think I said, it said 50% overlay or what? Thought I said.
I think it's a row to row. Hold on.
It should be here. Yeah,
Oh, 50%. Oh,
pulse the pulse.
but which one is it?
Increase the total number of passes to
It's according to, yeah, so you can do 50%.
All right, so can we just have like your number?
Yes,
Is that okay?
of course.
Yeah, that's what I.
And then I'll be, I'm in the middle of a
You
treatment.
might not like us in like a week.
Yeah.
Yeah,
Me
just send me
again.
pictures.
This is my patient,
Okay, we
say
go.
cheese. What should I do to her?
So it does say, yeah, so this is how I always thought, this is how I teach to do it.
Right,
I don't teach an overlap.
yeah, that's weird that they said that.
I would do,
Right next to it?
yeah,
Yeah,
Mhm.
okay.
and then
And
do
then
a
that's
second
what I
pass the
was
other way, right. So they look, and then it turns bronze, like pretty much.
And so this is like at the end of the day what it should
Mhm.
look like. Yeah, see with the pixel, this is just what it looks like right off the bat. Interesting, okay. And then what are you, this gets like a little bit brown, right?
It gets
And then it
brown,
just starts
and then
to
it's a scale.
like, mhm.
So Aquaphor right away, with this, you're not doing any of that stuff with 1540. You're not gonna use Aquaphor, I'm not gonna use, you're just gonna you can give them like an epidermal repair cream if you guys
Yeah.
have a company that makes one, but you don't need to.
We
They
have
don't really need
Lisa
to do
doing
anything.
numbing
I know.
to do her treatment.
Hopefully it's
We'll
gonna
see
work.
what we could treat her with.
Should I put my number in?
Is that mine?
I think so.
I think you might.
Lisa's numbing, right?
You can,
Yeah.
you're looking totally fine. I'll take that off, let me just put a little cream on your neck.
I think they put cream already.
Oh, you already have some?
Yeah.
All right, you're good.
Yeah?
Thank you for a lovely model.
Awesome, thank you.
You get an A plus.
Yeah.
A+, yay. My lips are still numb, I feel like I'm...
You did really good.
Yeah, sure.
You did good.
Alright, is that it? I'm good to go?
You're good to go.
Are any special
Alright.
instructions or anything I need to do, like?
Just sunblock.
that's
Careful
it?
on this
Okay.
side.
Yeah.
Alright, the normal, okay, cool.
Obviously, if you have any
Do
questions.
you know where you're
always give
going?
a call.
Do you know how to get out of here?
Yeah.
All right.
Okay,
Good
thank
to
you.
know.
Thank you so
Alright,
much.
take care.
Bye-bye.
Hi.
Yeah, I don't think it's any more fluid.
Yeah,
I mean, like, I feel like this has been happening since we got it.
it never happened to me until yesterday.
Oh.
And I've used it like a bunch, but yes, it is for sure. Happening to just come in.
My lord. The system's break if we can't do it on her.
We have not had good luck today.
Well, you're not doing that one.
No, but we at least need to get it to work or something.
She would not be happy.
She doesn't want that one.
She does not want this one. She is.
So we could do 1540 seems to be working, right?
Yeah, well, let's see if the Max G will work again. What does this mean? This
Oh,
means
so
that I
that's
need like
telling
a
you
tip
to
in
put
here.
a tip on.
Okay, that's something.
Well,
I wouldn't put the calibrator, just do,
yeah,
yeah.
just to see if it works. So what's the difference between? Oh, so it says it on there, right?
Yeah, so this is the one that you would use for the full face.
And
You
how
have
do you do
to,
this?
you have to like find the groove where it like goes
And
in,
make it snap.
and then, yeah,
Okay.
and then it snaps
Okay.
when you twist. You'll feel it. You're not gonna ruin it. You'll feel it.
Okay.
And then this is just, you know, your spacer.
Yeah.
So you also just.
Got water moving.
Just hang it up.
Kinda like it, wait.
I mean,
Snack or
yeah, there
She's got the spin. You gotta get home.
it.
Actually, you
It
know
goes
what?
in and then it just clicks it.
She catches it with her feet.
I know, she is so
And then to get it out, twist.
Twist and come out, and then you put your little cap on when you're not using it.
Okay, see.
And then you just put those back in the. Yeah, and those are your disposables. You can sterilize those
Okay,
or like alcohol on those.
And that's it for those?
Yeah.
Okay.
You guys would be better at this than I would. So
Right.
I mean, you know the wavelength, you know how to use it.
Right.
You just gotta do it.
And the settings, do we pull them or are they?
Yeah, so they're here.
I need a haircut.
What's 900 mean?
No, this is your pass. Your. This is mine and yours. I probably
Try to get
email
this
them
to
you
work.
'cause I
Yeah.
have.
Right, we need to practice on somebody with that 2140. Get somebody.
That's the hard.
You can't put it on in order to.
I have the manual on my iPad to send you guys electronically.
Yeah, can you do that?
Here you
Okay, cool.
go. No, it's 1540, sorry. But the chart looks exactly the same. Hold on. Here you go.
Alright, so we have the 6x6 groove. That'd be, which one? It's calibration.
Well, I tried to get it. Oh. I'll find out for you because I know people who use it every day. You guys will do that before I go. Training that they use. Don't say, could you go brush my memory and tell me how to do it?
Yes, these, so it's like zero overlap with these, and 50% with these. Short pulse energy.
Does that mean it's good?
So I would say that, I would like to see it fire because then I'll be able to tell.
Yeah, what you're supposed to do.
Yeah.
And what does this mean, coverage, 24%?
So that's the coverage you get by doing approximately
You
these
saw it, right?
passes with that
She looked
overlap.
good. She
This
looked
is
really
the
good.
coverage of the skin that
No
you're damaging.
problems.
Yeah.
We did the 2940.
Let me look on my.
I mean, the
See if
1540.
I can give you any answers.
Yes.
Yes.
So you have the blue,
How many passes
And one of
will
the
we do
two.
total?
6 by 6, we just don't
One
manage
and
one.
spot. One.
Can I
Unless
write-
this is the same thing, and it's just, this is the different settings for like a deeper wrinkle versus a finer wrinkle.
So
You
we
know what I
did
mean?
Mass Street, 10,
28 for vascular.
Yeah, because green, I'm assuming looks green, because all the other ones are
Right,
green,
yeah.
you know? Because I think he did tell us this.
that, I know that's the calibrator.
Yeah. I think he did.
Okay, so then, yeah, that's
This
exactly it.
was,
Okay.
no, we only treated
5.5. Because I,
and then we went back
and
for rounds, and that was it.
Oh,
We didn't do the 50/40. No.
Okay, around the same.
Forget what we did on the
Not
seventh.
working.
What did we treat Browns?
For Christina.
For Christina,
Yeah.
We did,
let me look at my manual. I have my computer here.
do we keep it at 10
10,
milliseconds?
32?
And
Did
then
we
I
go
did
there?
I think we bumped it up.
10 to 30, we
Did 10
increased it to 15 for the 8-law vessels.
Okay.
so 15.
I'm gonna just help clean up, because I gotta get.
15, what was it?
15, 36.
32, okay. Oh,
And that was full
When I
face or just spots?
Just
the
spots.
spots?
Lisa, we're gonna do the 1540 on her.
So we numbered
40
for
on
no
there.
reason. We didn't do the 50/40.
Did you hear what I said, Val? We should do a calendar, and instead of like snakes and stuff, we should have like the lasers wrapped around them.
You're nuts.
Could you imagine?
I'll let them know that that's what you're doing.
Will we potentially then do the browns, the red, and the 1540 all on the same day? Sorry, I thought.
No, it's totally fine.
What was the appointment?
You guys have a Wi-Fi?
We do, but it's not working. He was trying to fix it yesterday, and we just, as he doesn't, can't figure out why it's not working.
I'm just trying to get you the
Yeah, I know.
40 information that I don't have.
Yeah, that's not how old is she?
Maybe I can use my cell phone.
How to go with it. So we know baseline portion.
I'm thinking that I'd be all the Andy's the afternoon.
So what are we gonna do with this?
20 rules, like 4 misses.
And nothing?
No, they were like,
And that's a new,
yeah.
Struggle City, I would have that down here tomorrow. Or well, or will you just, no, it's not going. Yeah, like you said, I think it's outside of our
Yeah, I'm not a tech
capabilities.
support person.
It's amazing place. Plus it's,
Because that one also gave me like a water signal.
Which
that's good.
The other one, the Alma Club official. And then the water.
What are we gonna do?
I
with
just told
then?
Lisa, I don't know, or Lisa 1540.
Yeah, we could do the 1540 on her base.
I thought that's what was on the original.
She wants
We were
the
trying to get
IPL.
IPL going, but.
I think the top roof is what he has fixed.
Yeah, I mean, that's like, not bad.
You probably should go to Lisa then with the 15.
Here's these.
Yeah, I
They
just told
need-
her we were ready, yeah. Alright, you want to leave or just?
Those jeans are
Special
spot. Well, they can just go in the, for now, in the drawer in the room.
Yeah. Before you even go out, and take this back. I just wanna like, I don't wanna like mess up this room, it's supposed to be like sterile.
Yeah, I have all this. This can come out. We need it for her. Yeah, so we'll leave 2. Not sure who thinks those are. These are wrong. Okay, dokie.
All right, here I am. Oh, it's warm in here.
Are these just extra?
Yeah, I left them in, I was in
You
Jeffrey's
didn't
button.
know?
They're in the room that we usually are in for them.
Okay.
Alright, I'm ready for the pain. You know what the worst is? The unexpected. That's what I don't like
You'll
about
be
it.
fine.
What, did I get this on my hand?
You won't feel it.
I'm pretty numb. She did my nose. Who does, I don't even, you don't do my nose, do you?
Not like pores.
I got it in my mouth.
Yeah, that's the worst.
It was like, my tongue was numb. I was trying to drink the water and it's like. Oh, it is numb. Like I feel nothing. I don't think I've ever had.
Should I flick it?
I don't think I've ever had numbing on my face. I don't ever do numbing.
No.
No. I usually just suck it up.
Yeah, that's right, because you have a good time.
Or back for out
Feels
talking
weird.
over that.
I don't really know.
There's on your list.
Ew, I don't like this numbing. It feels weird.
Yeah.
Yeah.
Well-
After the dentist, we'll be able
Well, it just feels weird when you're touching me.
Yeah, because I'm touching it, you're not.
I'm feeling it, but it's like, it almost
But,
feels annoying.
patients get really wigged out during the ear drop. Some of them, if they're anxious, they're like, well, where are you now? Like, you can feel like a.
I'm gonna show you. So, I'm just looking at the PowerPoint. So, yeah, the groove and the lip. So the groove, we're trying to get to the point. So there are 3 different modes
almost
as
feels like
far
we're
as
rough.
the pulses.
Trying
There's
to
a
do
short
it.
pulse
Alright.
mode,
Beat
a
up.
long pulse mode, and a dual pulse.
Okay.
Let's see, yeah, and how you can do it. Let's just see how that translates. The key to understanding the display settings. So you have short pulse energy, long pulse duration, long pulse energy. And I think there's a way to shut this off, but let me just see. Oh, this is what
So
those
you
numbers
pick-
mean. Yeah.
Okay.
So,
First you pick short pulse or long pulse?
yeah, let me just see. Short, long pulse energy. Fixed 250 microsecond pulse energy. So this is a short pulse mode. It'll tell us why and when. Used primarily for ablation with minimal coagulation.
So like what would that be for? Just like
So if, so you don't, like, you could do, you can combine the 1540 and the 2940. So you could do your 1540 first, and then do your 2940 after, and your 1540 would serve as your coag,
right?
yeah.
So we technically could
So
skip
let me
that?
just explain, let me just understand, wait, hold on. I have to understand why. 1 plus 3 or 5 millisecond pulse that recommended favor, the 3.
Where's Marina?
Fire on.
Okay, why would you do that?
Is she all clean? We do alcohol?
I don't like this number thing. I think next time I just suck it up.
What are you feeling?
Because I feel weird. You're touching my face, but I can't feel it. It's like, I've never had numbing. Except for CO2.
What you did with the Pixel too?
No, oh no, I did do numbing with the Pixel. Maybe because we've had it on for so long.
How long have you been up for?
Probably like over 30 minutes, right?
Yeah, I'm on right now.
Settings. 920.
No, it's been like an hour.
Really?
That's good.
Every time I hear that sound, I'm like, ooh, and then I realize.
Plus I got Advil in me too.
Moderately surfacing. Use the. Use only the above suggested highlights.
Yeah, she could tell.
Vicodin.
Like, and you're driving.
Or
She's like, yeah, I'm
Percocet. I forget
good.
which one it was.
She's like, I'm
I
good.
think it was a Vicodin.
It was probably Vicodin. She's like, I'm good. I'm like, you're crazy.
I can't handle any of that.
Me neither.
I
But
didn't
she's
even-
used to it.
I didn't even take any of that after I had a baby.
She's used to it because she has a bad back, and
Mm.
kidneys and stuff, so she often has to take pain medicine.
Mhm. Is that what we have to just stay or just
Well, normal.
see what we have to look?
No, this is the PowerPoint.
Yeah.
I like to use, yeah.
What?
I'm trying to understand it, because I'm like, okay.
I
It's
did
not
have
making any
them.
sense,
We
but
went
it's
into
like, I don't
another
know
pool.
this
Yeah.
piece.
Then we got these big turn on.
Put them in the center.
Yeah.
Well,
You got
yeah.
freshies.
I got freshies because
How nice.
they kept getting infected.
Yeah. So did doctor sew it up for you too? Or
No.
just re-pierced?
Just re-pierced. I don't think they're gonna get sick. I think they're just
Yeah,
gonna
they look
close.
okay. Yeah.
I think they're just gonna close.
And hopefully this takes care of that.
So far, so good. Nothing, no infection. It's been 2 weeks.
Do your girls have their ears pierced?
Yeah, and I made them. I made them wear them for a year.
I changed it because like, see how low this one? I mean, if you actually look at the hole in that one, see it? How low it is?
Yeah.
We're doing good.
So I feel like if I did it here, it would look weird.
No, yeah, I agree. I think it looks good.
And same thing over here.
I think they're
These already
perfect.
kind of look like they're like closing up.
I know. I think
Yeah.
I think they are because if you
That's why I
don't
thought maybe they got stitched.
poke them every month or every week when I go out and stuff.
And I like these little.
I love
Yeah, they're
these
cute.
little ones. I want to replace them with little diamonds. But I'm gonna have to get stainless steel. I can probably find stainless steel.
Mhm.
But with my girls,
So,
I made them wear them for a year.
it's like 2 seconds.
A year solid. Never took them out.
Yeah, that's how I was really, really, really little. But
Okay,
I've had the same one since I was 4
I get the same
months.
thing. Like
Yeah.
at the end of the night, I'm like earrings in
Really
my bag, you know?
Oh, because they start to bother you.
Mhm.
Yeah. I rarely wear earrings. these
Yeah, me
days.
too.
Only like.
Yeah, well, doctor gave me the idea because she told Sophie to do it. I
Yeah.
was like, I'm doing it.
Is this a lock solution or the?
No, I didn't put anything
Yeah.
on. I just did alcohol.
Is it
More alcohol?
She still looks like numb. Scrub that skin. Yeah.
How do you pull the filter out?
Hmm?
How do you pull the filter out? Can you show me?
How do you put, oh, you don't wanna do that. You're gonna get water all over the place.
So how do you do it?
Sure we got, but you're gonna need a towel. You take this little,
Get some big
and you
Went up my
shimmy.
nose.
Don't do it. Just show me.
Okay. So then you shimmy this, and this just, it's almost like
Flush out.
it comes out, yeah. Just with this, and you do the same thing here. See,
Where did
see
you
how it
find that
shimmies
thing?
out? It's
Oh,
little, the from here.
I think it's like a
It's not the
swelling.
filters, I'm gonna tell you.
Well, should we just do the 1540s?
Swelling?
Well, you
Yeah.
know what I mean, like.
Yeah, that's fine. I don't think so.
Doesn't she look shiny? Maybe it's just because
Yeah,
her
I keep-
skin.
Probably
was,
from the numbing.
Yeah.
That's what I was
Alright, we're just
thinking.
gonna do the
Numbing.
1540.
I think it's.
Because this is connected. This is
Yeah,
well
but
connected.
that's where the problem is. I'm telling you the problem is here.
One of the patients had allergic reaction to the
I
numbing.
had 2 clicks.
Really?
I'm not having
Yeah,
allergic
but it's
reaction.
No, not at all.
not, so the
No,
reason
no,
why, the
no.
only thing that
It
explains
doesn't
this
believe
is
it.
that the
It doesn't make you
1540 is
swell,
working.
though.
And the reason is because 1540 doesn't need to hold the tip. It's in the handpiece here. It's something in the connection But the reason why it's telling you it's low fluid is not related to the fluid, it's related because the handpiece is not detecting enough fluid is passing in.
This guy does not need fluid.
Right, because this is not cool tip. This doesn't need cooling.
Okay, so it's not necessarily.
It's the connection to the handpiece not allowing the fluid to flow into here. And it's happening on all of your IPL handpieces.
Although it did just happen on the.
On your 2940. But that's what I'm saying. Either way, I can't fix the problem and you're not going to be able to either. You need someone to come fix it, for sure.
So I think, Baruch, it was happening from the beginning, Marina said. I never got it until yesterday. But Marina said she's been having it since we've had it. So I guess whatever it is,
It's getting looser
it's
or
getting
something.
worse.
Mhm.
Yeah.
Maybe you use the wrong water.
I thought we got special water for it.
Yeah, but
It's chiller fluid is just distilled
Alcohol.
water with alcohol. With ethanol, rather. 2%.
I call you. What can I do more than that?
That's all you can do. Just do your best.
It sounds like you're
Try
talking
my
to
best,
boys.
Mom. I'm like, okay, buddy, but you have to brush your teeth. Or
Try
you're
it.
trying your best with that. It's
Try
not
it.
an option. I'll try my best.
I'll get back to it.
You know. Don't hit your brother. I'll try my best, Mom.
At least they say that.
Yeah.
Yeah.
Well, as best as it's too good.
Yeah,
With a little.
My son's like, I'm sorry, I can't help it.
Yeah.
I'm like, what do you mean you can't help it?
Stew. He said a stupid because he's not allowed to say stupid. He said stew. He said stew. I'm like, that's just, I had to say a real word.
So
That is so funny. My mom and dad had the twins the other day, and they put the one in a timeout. He didn't know what timeout was. My mom's like, you don't do timeout. Like, she had to physically explain to him what.
How old is
Three. My brother's like, no.
I tried to put them both in a timeout the other day. The one was in one room, the one was in the other room. He's like, Derek, climb down from the seat and come save me. And they were talking to each other. And they were like, no, you're not allowed to talk. Didn't work. Totally worked.
Whenever
Call me please. I have this low
send
fluid flow and we are in the middle
Yeah,
of training and
we
it
would like slide words
doesn't look
under.
good. Give me a call when you have a second. Thank you. Okay, let me take a picture here.
Yeah.
It's weird on the lips.
Yeah, that gets to miss them.
How long does it take to
Where
wear
is
off?
Marina?
When does it wear
I'm
off?
not sure. Usually
hours.
it's like an hour.
You'll be fine by like Thursday.
Where'd the air come from all of a sudden?
I know.
I just turned it on.
I was like, where did that come from?
Didn't you say you were hot?
I said I was
Oh,
on.
you said you were hot. You get.
The patient was comfortable.
Yeah, no, I guess.
You said you were hot when you first walked in.
I took off my jacket, didn't I?
Jeez
Louise.
All right, let's try to plug this one in and see if it works.
yeah, hold that guy.
Let's try one last time.
Is that the one you used the
I
other
think
day?
probably it's going to work in an hour. Needs kind of a rest period, and this is why it worked before when I came after a while.
What, was it yesterday?
Oh,
Before? Yeah, but still, it's not good.
Yes, that was my tummy.
On other note, are we getting a machine to do the fat transfer here? And if so, when is our estimated date of arrival?
Right. What is fat transfer machine? There is no machine.
I know, well, the equipment for it, because Dr. Cross said he can't do it here.
Have to do it.
Because we have somebody who said,
One second.
Stephanie was in today with the kids.
Uh-huh.
She's in a lot of pain. She said she can barely sit. She said she's still swollen, but she said she's seeing a little bit of a result on her side already.
Is that your sister-in-law?
Mm-hmm.
Good.
How long has it
But
been?
she's still so swollen
A week today.
today.
Yeah.
But she can't sit.
No,
Can you tell? I mean, she doesn't, you can't tell over her clothes.
no, she looks,
She got her drains out?
yeah, Friday.
I mean, she's going to do that.
So
But
basically
Your
with
friend
the,
looks good.
Yeah.
sorry,
Mhm.
with the 2940, your blue is gonna be your go-to, that's like your moderate, and the
Okay.
groove is for the deep areas.
Oh, okay.
And
Can
then-
you use both in one?
You can,
Maybe use the
Um,
water first and then the deep? or-
yeah. And basically, you're gonna almost always do it at that 900 setting.
Okay.
I sent you the PowerPoint,
Okay,
but I'm just talking out loud, because I'm trying to
right.
get it
All right, ready?
myself.
So what are you doing today and what is it gonna accomplish?
We don't know yet, and we will get back to you.
Alrighty then. So basically you're
This is
just
like the,
playing with my body.
It's like the people.
I'm just start charging you people.
Oh,
And the
This is what
blue,
we
you
did
can,
on
the
the
blue you can
back one.
overlap.
I can hear the front one clicking.
I have to click
So the blue is,
something's clicked.
this is the 29.
Yeah.
and we did not
Sorry.
use that today,
I
right?
mean, it's in there.
So blue is moderate, you
Yeah.
said?
That's probably what you use mostly.
And to this full face, and then the blue is the spot treatment as well?
Yeah, it's a deeper one.
For deep, okay. What
For deeper
templates for this?
I would only do 1, 2s, and 3.
Three.
Next time what you need to do is to tell us
Yeah, you have to
what-
prep these people.
Yeah,
Yeah.
we did try that.
What were you saying about the blue?
Not
Oh, the
recently.
blue you can do a 50% overlap? No, yeah. And the groove you do just if you pulse the pulse, because it's deeper.
So the baby's up every hour on the hour.
Well, it's her.
Just, what, is she sick?
No.
It's just growing.
I think it's just like a sleep regression. I think we
4
need,
months, right? Yeah.
but it, for the past 3 nights, every hour on the hour.
All right.
And I'm just not used to it.
Remember having to nurse every hour on the hour?
No.
Oh my
I'm
god.
wondering if that would have been better. That would never
So,
I'm saying it's the same thing, so we're up all the
Still
time.
up, yeah,
so
but
what do you
like,
think for her for 1540?
How much downtime do you want?
none.
Just like redness and swelling.
Redness and swelling, I don't
15 to
care.
30.
Redness and swelling, I don't care.
But don't you want a good treatment?
I want a good treatment. Redness and swelling, I don't care. I just don't want that invasive.
Yeah, no, this is no scabbing or pressing or anything.
No stabbing or pressing. Redness and swelling.
She also had lots of
What do you want to do, 30?
Yes.
So her
No,
skin
she's fine.
You guys are troublemakers.
No, you want to see results, right? You are our spokesperson, so
I know.
We need to sit next.
no lots.
No, that's,
No lots.
that's right.
Is it just alcohol
Okay.
skin?
And what kind of?
Get to work.
I don't like these goggles.
I forget which
Yeah, this
one.
is the gauze. You have to, everyone needs to clean it.
No gauze on my eyes. That
You want
fan,
gauze?
where's that fan blowing? It's cold.
It is.
Okay, turn it off.
Do you want to make our patient card?
Yeah, which kind of outfit you wearing?
I like the big ones, but I'll deal with these. Just give me a minute to use this one. It's fine.
I don't think.
You don't want gauze?
I don't think they're okay.
Gauze underneath?
No.
Okay.
Why do you need to do that?
It just makes you feel more comfortable. It doesn't dig into your eyes much.
It's fine.
Yeah.
It makes me nervous. Yeah.
So this.
Nice firm pressure. You could do 50%, sorry, you could do 50% overlap, yeah.
What are settings for you?
15, 40.
I'm not in the mood for pain today.
And this always makes me so confused. So this means
You
standby?
ready? No, that means you're ready.
Ready.
Yeah.
All right, Lisa, you're
Of course, it's like this is the week before my periods too, or.
You have the number, you're gonna be fine.
You're gonna be great.
Am I confused?
I'm fine.
No, put your speed down, there's one like.
Oh, yeah, Kenyon, that's good.
Okay.
Okay.
How's that overlap? Okay. All right, Lisa.
I don't feel a thing.
So I do, like,
I do see a little bit of the, like, pattern there. Is
Yeah.
that normal? Okay.
And, you know, if you press a little, I mean, she's not feeling anything, which is fine, but if you press a little bit,
It's better.
it's better, yeah, for
Okay.
them.
But it does make a difference as far as the treatment is concerned.
Well, you can press and that'll like initiate the heat to go a little deeper.
But it won't cause hyperpigmentation or anything like that.
No.
The first for this place.
Yeah, it's always 15.
Even over there where they're barely numbing, it's not, I mean, I guess there's enough numbing, it just feels like a little pinch.
And so, 2 passes with this? How many passes would you do?
2 max. I think if you're doing a 50% overlap from row to row, you know, side to side, you're good.
So around the eyes where you pull down
Yeah.
into the same settings?
Yeah.
With this one, do you need to change the settings for the different areas? Or just like different areas, like forehead's fine to keep the same?
Yeah.
Because we're not
The
dealing
neck
with,
sometimes they'll get, you know what it is? They'll say a red little mark.
right,
So if you don't adjust, then
just more
They'll have more
downtime,
downtime.
but not an
it's
issue.
kind of weighted.
Yeah, so it's fine. And we're not targeting,
It's only water.
right, so it's,
That's it.
yeah,
I also think that the skin's around the neck, so that you don't have to.
doesn't need as much now. It reminds me of the, matrix.
Yes.
Maybe switch.
Well, I'm sorry.
No, you're fine.
Why are you gonna switch goggles?
You can see better in there, it's not you, not you.
I was gonna say, I'm good, don't mess with me. I'm sorry, I don't mean to
Are
be
you nervous?
No, no,
No, I'm fine, but I'm,
you're fine.
the goggle thing kind of annoys me, freaks me out, but I'm
What, you
comfortable.
like regular goggles? You don't like
Like
the
to
ones that
see.
you...
The pressure on the eyeballs is a little
Yeah,
you
I'm
know,
Well, that's why I wanted to put those under, but she said no.
I'm comfortable now.
Okay, so you stop together.
Who's picking up? All right. What?
Yeah.
Like if you go back and you can see stuff that you know, see.
I will get. Yeah, most of it, I'll like go back and go through.
The blazers like this, or even like the Pico, when you're doing like the focus ones, it's like, I hate it because it's so easy to do.
Yeah.
You know what I mean? That you can like really have to pay attention to what, not that you don't have to pay attention no matter what, but I could feel some heat though. From the,
Can't
On the right side.
On the right side.
Yeah, that's it. It's just the heat. That's why it's kind of
Do
doing
you want
the
the
treatment
squeezy ball
fast and
inside?
nice.
No.
You can give her the ice so she can cool down that side.
There's just one spot on there.
It's not, I'm okay without the ice, I don't wanna mess up you guys.
No, you're not
I'm
missing stuff.
just giving you
Feedback, okay. Well, if you need it, I have it on top.
No, it's fine, because it just feels like I just gotta light some and just starting to, heat up a little. It's not intolerable.
This is okay to go in there.
Yeah. I even like to stretch the skin because we always get a wrinkle and wrinkles with it.
Yeah, I didn't do that. That way you come on this side and do that. Or even like
You see how your rows are like, your pass is up top to bottom good, but row to row not as tight. You don't want to really see that.
So can
Can
I
you
go
go
over
Yeah, you can,
right
yeah.
now?
But just so you know for the future.
It should just be overall red.
Yes.
So I can do this. They're so hard to see.
It's hard to see.
The yellows.
Give her like a minute. You do this right here, here, and here.
So we're gonna get the GMAS to work.
No,
He called.
maybe conference.
Come on, Marina.
Have you ever been diagnosed with ADD?
Oh, totally have it.
With what?
ADD.
Totally have it.
Where were you? Did you have
No, I said,
Closer to her glasses.
She's in her head.
No, I've been,
Oh, I thought she
but I
said
also
in her head.
have submitted to beer dry, I have the one girl that has the abscess, so, you know,
What happened?
so everyone's out of like, I don't know, every couple hundred or 100.
Yeah, she's getting worse,
Who,
that abscess one.
Do her forehead before you go around
She
her
got an
mouth.
abscess or you asked her? From the injection?
No, it just could be if she had a cyst under there, even if it doesn't look like she never or a pimple ever, and you do the treatment, it gets really inflamed. And you won't know until you do the treatment with that. So what it is, it's just like a big cyst.
You have to drain it?
You drain it, but it also just oozes for the next 6 to 8 weeks. Yeah.
How long
it's just
ago
like
was
a
it?
sore.
What about that happened before or something?
I don't know if it's ever happened.
Just move her glasses down so you give her a nice.
I think the first person that they've ever done it to, it happened when I first started.
Oh, really?
I wonder if it's.
You need to go a little slower.
Okay.
Slow her down.
Yeah, you do.
Because you're missing your, you have to be flush with the skin.
Did Bruce say he was going to call?
I can make it.
Now that I'm not canceling myself.
He called and left a message.
Took a picture of the problem doesn't really.
Yeah, just make sure that it's laying like flat.
Flat.
Don't worry, it's nothing.
Yeah, but it's my, you know, my boss said it's kind of
Like perpendicular down to the skin.
Well, I think I have it
Slow, I can make it faster.
Wait a minute.
It feels the same as what you guys were
Oh, wait a minute, so I'm gonna put my, I don't have to go up and down,
No,
I
no,
can.
just leave, yeah, just
You
leave.
can,
it.
yeah, you
Right,
can.
right, I was doing both, and then that was really slow, that's why
Yeah,
I'm.
that's what I'm saying, I can make it faster if you want.
But your placement,
Okay, better now.
She's pushing really hard.
Too hard, okay.
Well, I don't know, you guys
Maybe
tell
on the
me.
forehead, it's not as.
No, I don't mind you pushing her.
No, I'm just letting you guys know what it feels like. My feedback is just for your education.
The feet. Do you want to make it faster, Gina?
Maybe a little. That's okay, I'll.
It's also helpful when they move with you. Like, so
Yeah,
now
that's
you're
what I do,
coming
yeah.
on the curve with their, so, you know.
Yeah.
Rough them up a little.
yeah, just move their head.
Yeah, make them do the work.
So you're also lined up with a cranky in there.
She's good, I can see it from here.
No, here you can see the hands of she's, don't move yourself, move her head, and always keep your hands on top,
Okay.
like that. Like that. You always want to work at a 90-degree angle, down. but you want to move her head so she's flush.
I feel like I'm being manhandled.
By two.
No, no, no,
Too
you're
many
fine.
people, you mean?
No, 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 I'm just,
So the nose. No big deal.
I think Danny did the nose.
So do you want me to do this?
Why do you
No,
actually do
no.
that?
Not on top like that because you can't get a flush.
Yeah, so I would just do
Just
it
do the
just
sides.
all
Sides.
Yeah.
So I don't need to do second pass if you did it big enough.
Alright.
I would do the second pass, to be honest. Not,
Is that okay to do there? Yeah, in between our eyebrows.
Yeah.
I did. Like, I feel like I did it twice and it's still.
Oh, I'm not even looking at the color, I just think because that's such a natural.
Make sure you do it both.
Put your tongue
No,
over
you
your
guys
chin.
didn't do anything here.
Yeah, let me turn it
I
up.
kind of did like right here and here.
I did here and here.
Better do it.
But actually,
Oh, I'm sorry. That's okay. Here's what these. No. See better, I think.
Did anyone do any of the lip?
No.
you do this more? Yeah. Let me start with lip. Wherever, just close your mouth, let me know I'm ready on me. Release a little bit, there we go.
Sort of like, point that out.
Can I open these?
you can open that.
Okay.
Oh, no, you're not,
Here.
not good, you're not good. What did you touch?
He opened the door.
Yes, nobody said no.
I didn't even see what he was doing.
I didn't know the answer.
I'm watching.
So I just didn't
Mid.
respond.
Mid-training.
We have like 3 more pulses.
So my
to do.
technician said it's the filter.
So you-
I know everything.
Sorry, Lisa. You alright?
Mhm.
promise that.
Numbers.
So what did he tell you to do? Change it? You have extras?
I don't have extra. It doesn't help me. But please, I'm going to send him the model so he can order it.
In the meantime, I'm gonna take a peek here.
You feeling burning?
Do you want to
No,
give her some?
sorry.
You can give her ice for the other side if you guys are done on that side.
Yeah, I just
You guys do move it.
right up here.
This is
Cause that hurts or something.
Where did this come from?
Right on the.
Was this someone else's?
I just need to clean up.
No, actually popped one earlier for Lisa.
Yeah.
I did pie, it might be done though, I'm not sure.
What time is it?
Almost
4:53.
Alright.
Alright, here we go.
No, I just want to make sure Julie's sorry.
No, it's not working then.
Well, luckily with this one, we'll
Yeah,
Well, we really only have 3 more pulses like on your lip and then we're good, so. That's what I'm doing.
I don't even feel this ice.
So on her neck you would lower it to like, we were at 40 for her here.
You have 40.
It's always 15, right? Is that what we
Always,
said?
always.
Always
Yeah.
15.
I'm gonna go do 30 then, you think?
Yeah, you could do 30.
Even 25 we could do,
Where are we at right now?
I would probably just do 30.
but 40.
Do you
Right,
use
we're
the
at 40 right
piece
now.
I
for
think
the-
so. I was, and then I found out I was pregnant
Yeah,
and stopped.
Bummer.
Everything.
Yeah, it's
My
like worse.
skincare, my skin
Yeah,
broke
it's
out
like
so bad.
Worse,
Oh
yeah.
my god.
I
Usually I
know.
get like, my skin gets clear with pregnancy. This time,
Ah.
I'm breaking out all over.
Girl.
Girl.
fine.
What do you have? I have 2 boys. So I'm like, what is going on? My skin is freaking out. I can't do my Botox. I can't do my.
I know. I used to call her Botox girl, like when I was nursing, like every week, like, any new studies coming out on breastfeeding?
It's crazy when you get used to this stuff.
Yeah, and you already like feel lousy, so then
Yeah.
you look lousy, it's terrible.
What about for the chest? Still 15-30?
Yeah, you can
Where
see
does
how
it
she
go
responds and
down?
how she feels, and then if you wanted to bring it down, you can.
Okay, let's go
Never
easy
felt
on
like
these
this.
shots. I don't need to be in all kinds of pain. I forgot to take my Claritin, I'll make sure I do that when I get home. This well.
You look good.
Well, that's the other thing, you don't want them to anti-inflammatory. I know Claritin's not, it's just a decongestant, but,
I did Advil, yeah, it's a little too late for
no,
that.
yeah, no anti-inflammatory.
Why?
You want the inflammatory response, that's why you're doing this.
Oh,
Avoid
geez.
inflammation.
Well, you're
So,
too
it's-
late, I see it happening, but.
So, yeah, I would just, anyone that's a big anti-inflammatory taker, just tell them to avoid it while they're
Okay.
healing.
There you go.
No post-treatment.
You did 1540, right?
I don't normally take it, so I just took some today, so it's not like it's in my
No, it's
system.
fine, yeah, as long as you're not like a chronic,
No, I don't, I mean, if I take it once a month,
yeah, but
Can
you
just
wanna
leave
try
that
and avoid
back
it.
I can take it off.
Yeah, just until you get to your list.
All right.
You wanna write it in one of the,
Finish, just need
I'll
some
write that.
orders.
and then put it in their phone.
Can we reinforce that next?
Turn
No,
your head
it's
for me
at
this
seven.
way, and I'm just gonna give this hairline and a
It's
couple
seven,
of
7:39.
things and you're
And
done.
you're up 24 hours a day, so you can call you, right?
Yes, I'm normally not.
Yeah.
I'm
Nine,
usually,
six,
my kids
seven.
sleep, 7:30.
Yeah, we're just, it's just fine.
Yeah, I'm sorry.
Yes.
Whatever else you guys say.
Frontera, Frontera.
I like to accomplish more.
Oh my God, the sales rep.
And he was like, I don't really know, this is a favorite word. We were like, all right, well, it's not their mostly favorite.
Yeah, we're
They made us like
gonna,
we're-
you're gonna mess us up.
Yeah, you guys did.
But that's
Yeah, I
why
had
it's
to take
easy. Some of them just don't pink off like the others,
Yeah,
but I know that that was it. Yeah, I think you look good.
and of course, more time it passes, you know.
It's gonna get in
It
there
gets
for all.
more, yeah.
Yeah.
Am I done?
Guys.
Well, then we'll be next, my next
Well, because our machine's not working.
We anticipated a lot more working.
Sure did, although I still feel like we
No,
got
we
a
did,
lot
we did a
covered
lot.
as far as
No, we
like
did a lot, yeah.
Learning.
settings and.
I'm sending everybody, this all information.
Yeah,
I
I'm
can't feel
good
the
with
ice. Is the
text.
ice gonna benefit or is ice just for comfort?
Yeah, and if I don't answer you back, it's not because I'm ignoring you, just that when I see patients, my phone is not
Yeah.
on me.
Yeah, I know.
And I don't have like an assistant or anything. I keep telling myself, I have to get an assistant. But,
So you're just a one-man show there?
no, I have an esthetician that does, like, we have sculpture, we have, hair removal I don't do,
Uh-huh.
but, like,
How do you-
all the other stuff I do.
How are your results with the sculpture?
Oh, we just got it. I had another, I'm coming from another technology, but,
What did you have previously?
it's called Vanquish.
Oh, yeah.
Which I loved, and we got very nice results. But it was 6 1-hour treatments, so it's such a pain in the ass. Yeah. Not for me because I wasn't doing it.
Right.
That was like
so we
that
turned off
color.
our cameras. Just so annoying, you know.
The accent was the absolute worst. All right, guys, there
right.
you go. How do we turn this off?
Oh, yeah.